Good evening, everyone. So for tonight, I will be discussing about NP1 and NP2 rationale for recalls 9. And hindi ko muna ito turn on yung camera ko, guys, ha, kasi nag-text talaga ulit ng advisory si PLDT sa mom ko na medyo slow yung connection. So if may problem sa connection ko, please inform me. Thank you. So let's start with number 1. A mother asked about what vaccines can already be given to her 5-week-old son. The correct response of Nurse Mika would be A. He should already have his first dose of BCG, Hep B, and OPV vaccines. B. Given his age, he is only eligible for BCG, Hep B, and pentavalent vaccines. C. He should already have his first doses of pentavalent, OPV, and PCV. And D, he has not yet reached the minimum age for the other vaccines, only BCG and Hep B. What are your answers here? Letter D. Correct. Your answers are, most are letter D. The correct answer is letter D. Hindi siya klaro, pero naka-bold to. Letter D, he has not yet reached the minimum age for the other vaccines, only BCG and Hep B. So this is the chart, or ito yung nilagay ko talaga sa wall ko, guys. Kasi this is very helpful. Like feel ko parang bonus na yung vaccines. You should memorize the number of doses, schedule, route, and amount. Kasi straight to the point yung questions about vaccine eh. Yeah, BH Pop. Next is number 2. The nurse is assisting the students on the preparation of the vaccines. As she was observing them, she will intervene when A. The student prepared 1.5 ml rotavirus vaccine. B. The student prepared the 0.05 ml pentavalent vaccine. C. The student prepared a 0.5 ml MMR vaccine. Or D. The student prepared 2 drops of OPV. This is NP1. The answer here is it's letter B. Kasi, ito. Yung pentavalent vaccine, dosage niya is 0.5 ml. Tapos sa BCG, yung 0.05. Yes, ito yung ginamit ko as reference. Next is number 3. To strengthen the fight and prevention against infant and child mortality, the government authored an act for mandatory basic immunization services for Filipino children and infants. This is also called A. RA 10152, B. RA 8976, C. RA 10028, or D. EO 51. Answers? Okay, the correct answer here is letter A, RA 10152. Next slide ko muna ha. Ito siya. Yung RA 10152, this is Mandatory Infants and Children Health Immunization Act of 2011. Yung RA 8976, Philippine Food Fortification Act of 2000. Yung RA 10028, Expanded Breastfeeding Promotion Act of 2009. And then, yung EO 51 is Philippine Milk Code. Yung EO 51, guys, just in case description yung hinahan or yung question is about description. And then confused kayo sa RA 10028 and EO 51. Yung EO 51, it's more on breast milk substitutes. It touches the topic of breast milk substitutes and supplements na dapat adequate yung information about them, sakto yung distribution. Tapos yung RA 10028, this is for allocation of space for lactation stations. Okay? Ako na po ba ask kung marami sa mga RA and mga vaccine? I think one situation worth yung lumabas na vaccine. Yung RA naman, I think less than 5 lang. Pero may lumabas talaga. Number 4, you are preparing to administer an IPV to a 14-week-old infant. Which of the following is the correct route for you to use? A, intradermal, B, subcutaneous, C, intramuscular, and D, the infant is too young to receive an IPV dose. The correct answer here is letter C, intramuscular. Next is, sorry, na-repeat lang yung, ito siya, again, this is a for those hindi nakapag-screenshot. Number 5. For infants, the nurse must know that this site is the choice for intramuscular injections. A, vastus lateralis, B, deltoid, C, ventrogluteal, or D, rectus femoris. And the answer here is, it's letter A, vastus lateralis. Screenshot niyo muna. So next slide ko. Ito yung vastus lateralis, guys. Dito yung site. This is the choice kasi the muscle is thick and well-developed. Kaya dito yung site na parang choice for IM injections. Next is another situation. Number 6. Tatay Talio visited the healthcare center asking about herbal medicine, specifically for lowering cholesterol level. Which herbal plant would you tell him to prepare? A, chaanggubat, B, sambong, C, yerbabuena, or D, bawang? The correct answer here is, yung answers ng iba. Thank you very much. The answer here is letter D, bawang. Screenshot yung muna. I'll change to the next slide. Ito siya. Yung main usage ng bawang as herbal medicine is for lowering cholesterol levels in the blood. Yung chaanggubat is for stomach ache and diarrhea. Sambong is against kidney stones and edema. Tapos yung yerbabuena for pain in different parts of the body. Guys, alam nyo, memorize ko to. Pero yung lumabas na herbal plant is not hindi siya part sa list ng DOH. Pero it's a familiar one. I forgot lang. Pero it's a familiar plant. Next is number 7. Lagundi. No, not lagundi. Part siya sa DOH list yung lagundi. 7 is, number 7. Aling Nena is complaining about the expenses for the maintenance medication of his type 2 diabetic husband. She asks if there are any herbal plants that can help with her problem. You would suggest her to prepare A, ulasimang bato, B, ampalaya, C, chaanggubat, or D, yerbabuena. And the answer here is letter B, ampalaya. Okay, I'll change to the next slide. Ito kasi indicated siya for DM types 2 patients as this herbal medicine lowers blood sugar levels. Yung ulasimang bato, it's anti-inflammatory, para rin siya sa hyperuricemia and gout. Yung gouty arthritis, ganun. Pwede siyang ibigay. Pero guys, yung ampalaya, hindi siya pwede na like sole treatment sa DM1 ha. Type 2 lang, pwede siya ibigay sa type 2 but not for type 1 because it is insulin dependent. Next is number 8. What are the main indications in using bayabas as a herbal plant? A, for lowering uric acid, B, for diuresis and antiperspirant, C, for cleansing wounds and mouth infections, or D, for lowering LDLs. And the correct answer here is? Correct answer here is letter C, for cleansing wounds and mouth infections. Dito siya. Yung sambong is diuretic, bawang is lowering LDLs, and then ulasimang bato is lowering uric levels. Oh, wait lang. Ano na po yung hindi pwede sa buntis na herbal med? I think I'm not really sure kung ano yung specific na herbal plant na hindi pwede sa buntis. Yung sa amin kasi ito nasa pre-boards. Okay. Okay, okay. Okay, yung Acapulco, yun, yung antihelmintic. Thank you. Next is timing, number 9. Which of the following conditions would benefit most from Acapulco? A, diarrhea, B, toothache, C, athlete's foot, or D, tension headache? Answer here is letter C, athlete's foot. Kasi antifungal, ringworm, at athlete's foot, and scabies. Ba't na-repeat? Okay. Number 10, a friend asks you whether there's... yes, oo, yung Acapulco, guys. Kaya pala siya. Meron siyang, I just remembered, kasi nasa notes yun. Nasa notes ko yun. It can induce preterm labor or even abort pregnancy. Pero I can remember it can induce labor. It's yung tiniting ko is bayabas kasi, I mean, yerba buena kasi pain. But I wasn't sure, kaya hindi ko sinagot. Next is number 10 ito. A friend asks you whether there is herbal medicine for pain. Which response would be correct? A, you can prepare yerba buena. It's very helpful for pain relief. B, chaang gubat is what we recommend for pain relief. C, you should try nyug-nyugan. It has great analgesic properties. Or D, I'm sorry, but there's no herbal medicine that can help relieve pain. The answer here is letter A. You can prepare yerba buena. It's very helpful for pain relief. Number 11. The nurse mentioned that she has assessed a patient with early signs of leprosy. Which of the following would be considered an early sign or symptom? A, madarosis, B, sinking of nose bridge, C, gynecomastia, or D, pain and redness in the eyes? And the answer here is D, pain and redness in the eyes. Of the eyes pala. Ito siya. This is a list of the early signs and symptoms of leprosy. First is change in skin color, either reddish or white. Meron din loss of sensation on the skin lesion. Decrease or loss of sweating and hair growth over the lesion. Thickened and or painful nerves. Muscle weakness. Pain and redness of the eyes. Nasal obstruction or bleeding. And ulcers that do not heal. Okay. Source ko dito is yung White Book. Yung Public Health Nursing in Philippines. And then, ito yung late signs. Late signs, madarosis, loss of eyebrows. Lagophthalmos, inability to close eyelids. Clawing of fingers and toes. Contractures. Sinking of the nose bridge. Enlargement of the breast in males or gynecomastia. And chronic ulcers. Next is number 12. What is the duration of treatment for post-bacillary treatment of leprosy? A, 3 to 4 months, B, 5 to 8 months, C, 6 to 9 months, or D, 9 to 12 months? The answer here is letter C, 6 to 9 months. Ito siya. Okay. Yung post-bacillary, it encompasses tuberculoid and indeterminate leprosy. So, para siya sa non-infectious types. Tapos, yung duration of treatment niya is 6 to 9 months. Yung multibacillary naman, it encompasses lepromatous and borderline. So, infectious types and duration of treatment is 24 to 30 months. Pause kasi. Guys, if you have your own funny ways of remembering stuff, then do it kasi very, very helpful. Pero make sure na you know the info behind it, ha? Hindi yung joke. Kasi baka sa exam yung joke yung maalala nyo, pero hindi yung info talaga. Next is number 13. Ma'am, anong CD lumabas sa inyo? Aha. Leprosy. It's leprosy. Number 13, the drugs included in paucibacillary leprosy treatment are A. Rifampicin and ethambutol, B. Isoniazid and dapsone, C. Ofloxacin and ethambutol, and D. Dapsone and rifampicin. Answer here is letter D. Ito siya. Yung ethambutol, that's for TB. Isoniazid, also for TB. Yung ofloxacin is an antibiotic. So, yung tama talaga dito is dapsone and rifampicin. Next is number 14. Which of the following vaccines can contribute to the protection against leprosy? A. Varicella vaccine, B. BCG vaccine, C. Haemophilus influenza B vaccine, or D. None of the above. And the correct answer here is letter B, BCG vaccine. Makaka-protect rin siya against leprosy, despite being initially developed for TB. Next is number 15. All mentioned below are affected by leprosy except A. Skin, B. Pleural space, C. Testes, or D. Mucous membrane. The answer here is letter B, pleural space. Kasi leprosy mainly affects the skin, the eyes, and the mucous membrane. Next is number 16. This disease is also called snail fever, which has long been one of the important tropical diseases in our country. A. Schistosomiasis, B. Malaria, C. Bacillary dysentery, or D. Filariasis. Filariasis pala, sorry. Answer here is letter A, schistosomiasis. Guys, like what I've said last night, other terms you should also know it. Kasi baka lalabas si snail, ano yung symptoms ng snail fever and then di nyo alam ano si snail fever. So sayang yung point. Number 17. The mode of transmission for schistosomiasis is A. Being coughed at by an infected person, B. Having intercourse with an infected person, C. Swimming in a contaminated fresh water, or D. Being injected with a non-sterile needle. And the correct answer here is letter C. Kasi a person can get this infection kasi nangyayari to when the skin comes in contact with contaminated fresh water in which certain types of snails carry the schistosomes. Next is number 18. The drug of choice against schistosomiasis is A. Zidovudine, B. Penicillin, C. Clotrimoxazole, or D. Praziquantel. The answer here is letter D, Praziquantel. Yung Zidovudine, HIV positive pregnant women to reduce the chance of passing the infection to the baby. Yung penicillin naman, para siya sa wide range of bacteria. And then yung clotrimoxazole, they treat bacterial infections such as pneumonia, bronchitis, and infections of the urinary tract, ears, and intestines. Ma'am, lumabas ba yan sa boards? No. Pero I think the other CD, I think trend ngayon talaga is communicable diseases. Next is number 19. The nurse is assessing a patient with leptospirosis. This is mainly caused by A, virus, B, bacteria, C, fungi, or D, flatworm. And the answer is letter B, bacteria. Next is number 20. The mother of a patient with leptospirosis asked you why the symptoms have only appeared now when her child has walked through the flood almost a month ago. What would be the correct response? A, the incubation period can range from 7 to 19 days, which is why the symptoms only have appeared now. B, it only takes less than a week for the symptoms of leptospirosis to occur. C, I think you meant more than a month since the incubation period of leptospirosis is 28 to 36 days. Or D, are you sure it has been almost a month? The incubation period is just 3 days. O diba, nang gaslight pa siya. Ayaw niya makinig sa almost a month ago. The correct answer here is letter A. The incubation period can range from 7 to 19 days, which is why the symptoms only have appeared now. Kaya siya guys, parang hit and miss yung CHN kasi ang daming info and then 100 items lang yung lalabas eh. Kaya if you studied the right diseases, the right concepts, then you win. Number 21, incubation period sa amin. I think wala. Number 21, the purpose of having code of ethics for nurses is A, define the limitation of nursing practice, B, to assist the public understand the professional behavior that is anticipated from nurses, C, indicate nursing action recommended for specific medical circumstances, or D, to outline the responsibilities and duties of the health professionals, nurses, and patients. What are your answers here? The correct answer is, it's letter B. It's letter B. To assist the public understand the professional behavior that is anticipated from nurses. Yung A, C, and D is more of scope of practice. Nakatulong. Yung white book lang yung only book na binasa ko talaga. Not cover to cover, pero binasa ko lang siya. Hindi ko na nga nabasa yung green CHN book eh. Number 22. Ethical dilemmas exist because of A, the choices available do not seem to be indisputable right or wrong. B, decision-making is time-bounded. C, decision is based on the intellectual capacity of the healthcare provider. Or D, a client's legal rights and the nurse's duty to practice professionalism coexist. Ma'am, nag-sobrang memorize ka ba? Sa lectures, oo. Like, I really read the lectures and the notes from Top Rank. Answer here is letter D. The client's legal rights and the nurse's duty to practice professionalism coexist. Hindi pwede yung letter A, guys. It sounds right, pero yung issue talaga dito is the professionalism and the right na nagka-clash. Example, they say, ayoko na talaga uminom ng gamot na to. Tapos may duty tayo eh, 'di ba? Non-maleficence, may beneficence. Yung letter C, intellectual capacity, you don't need to be smart to know that there is an ethical dilemma. Hindi mo naman sasabing, sir, ang bobo ko eh, wag mo na, if di ka gusto uminom, and then wag ka na lang uminom. It's not about intellectual capacity. Next is number 23. Yung module ko na sinand or person. To be honest, yung notes from the lectures. Ang kapal ng modules, guys. Pero yung modules and then yung notes, it's just the same. Super detailed yung modules nga eh. Number 23, if a nurse violates the code of ethics, there is a big possibility of his or her license being revoked. Who revokes the license? A, PRC, B, BON, C, DOH, or D, PNA? Answer here is letter B, BON. This is found in Section 9 of RA 9173, Powers and Duties of the Board. Ito naman yung RA 9173. Binasa ko lang siya mga 2 or 3 times. Pero not really memorize the whole thing. Familiarize lang. Number 24. According to Lawrence Kohlberg, a subjective feeling about what is right or wrong is said to be A, morality, B, religion, C, beliefs, or D, bioethics. And the answer here, kinda self-explanatory na to, no? It's morality. Next is number 25. When patients cannot make decisions for themselves, which ethical principles will the nurse use her basis on? A, justice and beneficence, B, beneficence and non-maleficence, C, fidelity and non-maleficence, or D, fidelity and justice. And the correct answer here is letter B. Kasi 'di ba, yung beneficence doing or promoting good, and yung non-maleficence is do no harm. So this is the best ethical principles when helping them make a decision. Kasi wala namang issue between a right to fair treatment or honesty or integrity, which is the main topic of justice and fidelity. Tinapos mo po modules ni TRA. Scan lang. If scan, yes. If like read talaga na read, then no. 26. Patrice, a 6-month-old infant, was brought by her mother to the healthcare center because of diarrhea reaching 2 times a day. Her skin goes back slowly after a skin pinch and her eyes are sunken. Using the IMCI guidelines, you will classify this infant in which category? A, no signs of dehydration, B, some dehydration, C, severe dehydration, or D, the data is insufficient. Guys, yung diarrhea, this is typo. 3 to 4 times a day, dapat yan, if diarrhea. And the answer here is letter B. Some dehydration. This is based here. Okay? Some dehydration, ito siya. It says sunken eyes and skin pinch goes back slowly. Next is number 27. Were you able to read or recall exams po? Part of the study material talaga is the recalls. So, we needed to study that one. Malaki po ba? Yes, oo. Malaking tulong yung final coaching and closed door kasi parang na-narrow down yung ano dapat i-study nyo. But again, it is not expected talaga. Na 100% ano yung sinabi sa inyo, then yun din yung lalabas. Number 27. Chris manages the diarrhea of her 3-year-old child with the use of Orisol. She asked you, what will I do if she vomits this? As a nurse, you will tell her to A, bring the child to the nearest hospital to be assessed by a pediatrician. B, let the child eat his or her favorite snack. C, bring the child to the health center for assessment by the physician. Or D, let the child rest for 10 minutes, then continue giving Orisol more slowly. The answer here is Orisol, guys, di ba? Hindi siya ganun delicious for a kid. So the answer here is letter D. Let the child rest for 10 minutes, then continue giving Orisol more slowly. If persistently vomiting na siya, and then that's when you can refer to the hospital. Pero if it's just because of the Orisol and then parang speed run yung pagkabigay sa kanya, then let the child rest for 10 minutes. Ano mas mahirap? Recalls or boards? Boards, of course. Range of scores niyo po sa recalls, no, not joking, 50 to 60. And then yung 60, I only reach 60 around recall 7 or 8 na. And then recalls 9 yung last namin. So, late bloomer. Number 28. No, hindi yung Saunders, I read it for psych. Number 28. Kiefer, a 4-month-old infant, was brought by her mother to the health center because of a cough. His respiratory rate is 42 per minute. Using the IMCI guidelines of assessment, his breathing is considered as A, fast, B, slow, C, normal, or D, insignificant. The answer here, 42 per minute raw and 4-month-old. Answer here is C, normal. You screenshot this one. Ito. Pag 0 to 2 months, fast breathing is 60 up. Yung 2 to 12 months naman, yung fast breathing is 50 up. Tapos yung fast breathing for 12 to 60 months is 40 up. Ma'am, hindi pwede mag-breastfeed si HIV mother. Yes po, top-notcher ako. Topic. Parang nagkaka-imposter syndrome na ako, guys. But yes, I'm a top-notcher. I may not sound like one, but yes, I'm one of them. Top 8 po, last November 2022. Number 29. In integrated management of childhood illness. Oh, wait, my question. Ma'am, 4 months po pero 42 per minute. Yeah, 2 to 12, yung 4 months, dito siya na-belong sa 2 to 12. And then, it says 42, so normal lang. If 50 up, fast breathing na yan. $60 po pinaka... no. Yung highest ko sa recalls is 78. Ganun. Number 29. In IMCI, the nurse is aware that the severe conditions generally require urgent referral to a hospital. Which of the following severe conditions does not always require urgent referral to hospital? A, syncope, B, severe dehydration, C, severe pneumonia, or D, severe febrile disease? The answer here is letter B, severe dehydration. Kasi guys, yung order of priority dito, ito ha, IV fluid, and then you refer to a facility na makakapagbigay ng IV fluid within 30 minutes, and then Orisol by NG tube. If hindi talaga naagapan using those three, then you refer to a hospital. But guys, if the situation says has severe dehydration and another severe classification like severe febrile disease or severe pneumonia, then refer nyo na. Balik sa 28 po, ma'am. Ito ba? You need to screenshot this one. 1, 2, 3. Or this one. Ito po. 1, 2, 3. Next ko na number 30. Wait, may na... Ma'am, kapag po may severe dehydration, hindi muna po refer sa hospital po. No. Guys, balik ko ha. Ito. Ito siya. If child has no other severe classification, give fluid for severe dehydration. Pag meron na siyang severe classification with the severe dehydration, you refer urgently. Kaya yung ratio dito, wait, sana yun? Yung ratio dito, pwede ka pang magbigay ng IV therapy, punta ka sa healthcare facility na makakapagbigay ng IV fluids like healthcare center, and then Orisol by NG tube. If nagagamot na yung modern diagnosis. Nakakalito kasi. Thank you. For safety, guys, ha, yung ibibigay nyo sa baby with na may HIV yung mother is yung breast milk din, pero by another, yung sa ibang mothers. Pwede daw po yung breastfeed sa may HIV po. Huh? Basta sa amin, study pa lang ata. It may be, kasi hindi na, I really can give a rationale based on what I know, ha. Pero, to be safe, hindi talaga pwede mag-breastfeed for pag HIV si mother. As long as nag-take ng meds. Breastfeeding outwasters. Okay. Okay, gets. The benefit will outweigh the risk. Okay. Understood. If given na, okay. Sorry, ang hina ng there. If nagdi-drink ta ng med si mother. Pwede siya if nagdi-drink ta ng med si mother. Next is number, okay na po. Next is number 30. Lina brought her 4-year-old son to the health center because of cough and colds. Following the IMCI assessment guide, which of the following is a danger sign that would signal you to refer the child to the nearest hospital immediately? A, inability to drink, B, high-grade fever, C, signs of severe dehydration, or D, cough for more than 30 days. And the answer here is A, inability to drink. Ito siya, guys. Refer immediately yung mga bata na 2 months to 5 years old if hindi sila nakaka-feed or drink and then vomits everything, may convulsion, and then abnormally sleepy or difficult to awaken. Safe na score for pre-boards? Guys, as long as hindi ako nag-top sa pre-boards namin eh. So, I really can't say what's the safe score. But to be safe, ang goal ko talaga nun, when I was still reviewing, is 75. Kasi yun yung passing 75 each subject. 60 each subject, but the average should be 75. So technically, 75 lahat. Number 31, which of the following communicate the results of the research to the readers? They facilitate the description of the data. A, hypothesis, B, research problem, C, independent variable, or D, tables and graphs. Communicate the results, ang sabi. So, it's probably not hypothesis, research problem, or independent variable. This is tables and graphs. Next is number 32. Which of the following is not true about a pure experimental research? No problem. A, there is a control group. B, there is an experimental group. C, selection of subjects in the control group is randomized. Or D, the experimental group is formed in a criterion-based selection. Pure experimental daw, guys. So the answer here is letter D. The experimental group is formed in a criterion-based selection. Dapat random. Dapat walang criteria. Next, here is number 33. You are to perform a study about how nurses perform surgical sepsis during Philippine-American War. A design best for this study is A, historical, B, phenomenological, C, case study, or D, ethnographic. Philippine-American War daw, guys. Something sa history. So it's letter A, historical. Kasi yung purpose ng historical research design, para maka-verify and gather data from the past, para ma-understand siya. Next is number 34. The sampling method that gives equal chance to all subjects in the population to get picked is A. Random, B. Accidental, C. Quota, or D. Case study. The answer here is equal chance, letter A. Random gives equal chance to all subjects in the population. Next is, na-screenshot na ba? 1, 2, 3. Next is number 35. A nurse researcher wants to determine some of the problems that are experienced by asthmatic clients when using a nebulizer. The investigator went into respiratory ward where he personally knows several asthmatic clients having problem with their nebulizer. The type of sampling done by the investigator is called A. Probability, B. Snowball, C. Purposive, or D. Incidental. Sana ganito lumabas. Sana nga guys, pero mahirap yung words talaga. The answer here is letter C. Purposive. Kasi yung purposive, this refers to units are being selected because of the characteristics. Alam na ni researcher na may several asthmatic clients na may problem with their nebulizer. So yun yung point ng purposive. Yung incidental, the population is close or easy to reach. Yung snowball naman, para siyang networking. Screenshot na, 1, 2, 3. Next is number 36. Nurse Nadia is already in her data gathering part of the study. Which of the following criteria of a good instrument refers to the ability of the instrument to yield the same results upon its repeated administration? A. Validity, B. Specificity, C. Sensitivity, or D. Reliability. And the answer here, guys, is letter D. Pag sinabing reliability, guys, always remember the word consistency. This is the consistency of the research instrument. Yung pwede siyang ma-repeat in extracting the same responses. Yung validity, this is for how accurately a method measures what is intended to measure. Yung specificity and sensitivity, these are more like mathematics type, like accuracy of a test in which it reports the presence or absence of a condition. Next is number 37. Harry knows that he has to protect the rights of human research subjects. Which of the following actions of Harry ensures anonymity? A. Keeping the identities of the subjects confidential. B. Obtain informed consent from the families of the respondent. C. Provide equal treatment to all subjects of the study. Or D. Release findings only to the participants of the study. The point here is anonymity, so the answer here is letter A. Keeping the identities of the subjects confidential. Next is number 38. The leader of the study knows that certain patients who are in specialized research setting tend to respond psychologically to the conditions of the study. This is referred to as A. Cause and effect, B. Hawthorne effect, C. Halo effect, or D. Horns effect. Alam nila na may nag-o-observe sa kanila. This is Hawthorne effect. Yung letter C, guys, halo effect, overall impression of a person influences how we feel and think about their character. And then yung horns, it happens when you make a snap judgment about someone on the basis of one negative trait. So nagkasala lang sila once, yun na, judge mo na siya for their whole personality just because of that one trait. Number 39. Nurse Myrna is aware that the Board of Nursing has quasi-judicial power. An example of this power is A. The board can issue rules and regulations that will govern the practice of nursing. B. The board can investigate violations of the nursing law and code of ethics. C, the board can visit a school applying for a permit in collaboration with CHED, or D, the board prepares the board exams. The answer here is letter B. The board can investigate violations of the nursing law and code of ethics. Next is another situation, number 40. As a nurse, one of your jobs is to reduce patient risk in harboring infections. Which element in the circular chain of infection can be eliminated by preserving skin integrity? A, host, B, reservoir, C, mode of transmission, or D, portal of entry? Broken skin is a portal of entry. No, so if there's broken skin, the pathogens can enter. Next is number 41. Which of the following will probably result in a break in a sterile technique for respiratory isolation? A, opening the patient's window to the outside environment. B, turning on the patient's room ventilator. C, opening the door of the patient's room leading into the hospital corridor. Or D, failing to wear gloves when closing the door of a patient. The answer here is letter C. Opening the door of the patient's room leading into the hospital corridor. Guys, yung patient's room, it should be well ventilated. So, desirable tong letter B. And then, okay lang din yung letter A kasi outside environment naman. Yung letter C talaga is, dapat kasi naka-strict isolation. Dapat remain closed yung door. Next, number 42. Which of the following patients is at a greater risk for contracting leukopenia? Parang paulit-ulit to. I think this should be infection, but A, patient with leukopenia, B, patient with receiving broad-spectrum antibiotics, C, patient complaining of headache, or D, newly diagnosed diabetic patient. Andito na yung answer eh. So, letter A patient with leukopenia. Leukopenia, ito yung decreased number of leukocytes. So, meron siyang problems when resisting infection. Number 43, sterile technique is always used whenever A, strict isolation is required, B, endorsement and transfer of patient is performed, C, invasive procedures are performed, or D, protective isolation is necessary. The answer here is letter C, invasive procedures are performed. Ito yung surgery, catheter insertion, parenteral therapy, dapat sterile technique yan sila. Yung letter A, they use clean gloves, masks, gowns, and equipment. Tapos, yung protective isolation, this is to prevent a person with impaired resistance from coming into contact with organisms. Number 44. Which of the following constitutes a break in sterile technique while preparing a sterile field for dressing change? A, sterile forceps rather than sterile gloves to handle a sterile item. B, touching the outside wrapper of sterilized material without sterile gloves. C, placing a sterile object on the edge of the sterile field. Or D, refraining from reaching over the sterile field. Answer here is letter C. Ma'am, all? No, it's not. For example, yung NGT, di ba? Like, invasive din siya. Pero based on this question, yeah, medyo worded wrong siya. Pero based on this question, yung letter C yung best answer for sterile technique. Yeah, my word kasi na always. You're welcome. Number 44. Ato, nare-read ko na. So yung answer dito is letter C, placing a sterile object on the edge of the sterile field. Kasi di ba yung border of 1 inch of the edge sa sterile field, non-sterile na yan. Kaya dapat nasa loob ng sterile. Place all objects inside the sterile field and away from the 1 inch border. Next is number 45. A natural body defense that plays an active role in preventing infection is A. Yawning, B. Body hair, C. Hiccuping, or D. Rapid eye movement. Answer here is letter B, body hair. Yung hair sa nose, yan siya, it traps and holds particles that contains microorganisms from entering the body. Number 46. Informed consent is taken to assure that the client's autonomy is respected. As a nurse, you should know the principles and your responsibility in securing the informed consent. 46. Performing a procedure on a client in the absence of an informed consent can lead to which of the following charges? A. Fraud, B. Battery, C. Harassment, or D. Breach of confidentiality. And the answer here is letter B, battery. Simple battery, this may include any form of non-consensual, harmful, or insulting contact. Ma'am, sa number 42, sabi po sa grade. Yeah, parang may mali yung, I think the question talaga is contracting infection. And then leukopenia yung answer. Difference ng battery and assault. Guys, the way I remember this kasi I'm always confused about this two before. Battery, parang nanapak na talaga. And then yung assault, verbal lang or like parang threat muna. Pero yung battery may ginawa ka na talaga. Number 47. Which of the following is the essence of informed consent? A, it should have durable power of attorney. B, it should have coverage from an insurance company. C, it should respect the client's freedom from coercion. Or D, it should disclose previous diagnosis, prognosis, and alternative treatments available for the client. Answer here is letter C. It should respect the client's freedom from coercion. Yung point talaga ng informed consent, guys, dapat free silang gumawa ng kanilang decision. They must be competent to make a voluntary decision about whether to undergo the procedure or intervention. Number 48. The main responsibility of the nurse when the physician obtains the informed consent is A, explain the procedural alternatives, prognosis, and diagnosis. B, listen to the physician's explanation. C, make sure that the client fully understood the instructions, the consent was given voluntarily, the signature is authentic, and the client is competent when receiving the consent. Or D, same thing, but the client is competent when giving the consent. Answer here is letter D. Yung patient ang nagbibigay ng consent, hindi sila ang nagre-receive. Next is number 49. Autonomy is said to be the bioethical principle respected. If the nurse made sure that the client received enough information when the physician obtained the consent, asked and verifies if the client understood the procedure, and informs the physician if the client has some questions regards to the diagnosis, procedure, alternatives, and prognosis, the nurse is playing which role? A, mother surrogate, B, care provider, C, client advocate, or D, collaborator. The answer here is letter C, client advocate. Kasi nurses that are advocates, dapat ini-ensure nila na yung services, policies, and regulations, it meets the patient's needs while keeping them safe. Guys, mother surrogate. Yung surrogate, guys, parang siyang substitute for another human being who is well known to the client. This is by Hildegard Peplau na definition. So you're acting like a mother if it says mother surrogate. Number 50, guys, I'll give you a 10-minute break every 50 items, but kasi new situation na siya, so I'll give you one na muna. Balik kayo 7:04 p.m. Thank you. 7:05 pala. Kasi malapit na mag 6:55. So 7:05. Hi guys, we're back. So, wait, my question. 42. Pwede balik. Risk. Okay. Ito siya, guys. At a greater risk for contracting. Honestly, I think when I made this question, I think I really wrote here is infection. This is a faulty question and I apologize for it. But this is actually a greater risk for contracting infection. Kasi redundant yung contracting leukopenia and then a patient with leukopenia. So this is really just a faulty question. That's why A yung answer. It's okay, it's okay. Sorry guys. This is at a greater risk for contracting infection. Walang ganito guys sa boards, don't worry. Walang faulty questions. If it sounds faulty, then that's probably for a reason. May iba po kayong test mo. Top rank lang po. Top rank lang. Continue tayo ha, number 50. Situation, nursing organizations has been established to enhance the growth of profession as well as its members. Established in 1896, this is the National Professional Organization of the United States of America. A, ANA, B, ICN, C, PNA, or D, CNA. And the answer here is A, ANA, American Nurses Association. Number 51, Anastasia Giron Tupas presided in the founding of the PNA on A, September 2, 1922, B, September 2, 1927, C, October 2, 1902, or D, October 2, 1922. The answer here is letter A, September 2, 1922. Next is number 52. Nurses in the Philippine government also felt the need to organize themselves. This leads to the creation of A, National League of Government Nurses, B, National League of Filipino Government Nurses, C, National League of Philippine Government Nurses, or D, Philippine Government Nurses Association. And the answer here is letter C, National League of Philippine Government Nurses. Number 53. Mr. Santos, a community health nurse, is assessing the nutritional status of a group of elderly residents in a residential care facility. He finds that many of them have poor appetite and difficulty eating. What would be his most appropriate intervention? A, recommending a commercial liquid meal replacement for all residents. B, providing individualized meal plans based on their dietary preferences and restrictions. C, referring all residents to a nutritionist for assessment and counseling. Or D, consulting with a speech therapist for evaluation and management of swallowing difficulties. And the answer here, dapat consider nyo yung pagka-CHN nurse nyo guys. So letter B, providing individualized meal plans based on their dietary preferences and restrictions. Kasi each resident, they may have different dietary needs and preferences. Next is number 54. Public health services are given free of charge. Is this statement true or false? A, the statement is true. It is the responsibility of government to provide basic services. B, the statement is false. People pay indirectly for public health services. C, the statement may be true or false depending on the specific service required. Or D, the statement may be true or false depending on the policies of the government concerned. And the answer here is letter B. Statement is false. People pay indirectly for public health services. This is through taxation. Number 55. According to C.E. Winslow, which of the following is the goal of public health? A, for people to attain their birthrights of health and longevity. B, for promotion of health and prevention of disease. C, for people to have access to basic health services. Or D, for people to be organized in their health efforts. The answer here is letter A, for people to attain their birthrights of health and longevity. Ang taas ng definition niya, guys, pero andito na siya sa last part. So those who want to screenshot, you can screenshot. Number 56. We say that a Filipino has attained longevity when he is able to reach the average lifespan of Filipinos. What other statistic may be used to determine attainment of longevity? A. Age-specific mortality rate. B. Proportionate mortality rate. C. Swaroop's index. Or D. Case fatality rate. The answer here is letter C. Swaroop's index. Kasi yung inverse niya, guys, di ba, yung Swaroop's index, percentage of the deaths aged 50 years or older. Yung inverse naman niya is the untimely death, so younger than 50 years. Hindi pa na yung age-specific mortality rate kasi it could be this is age-specific, so pwede na 10 to 20, 20 to 30. It doesn't touch the topic of longevity. Yung proportionate mortality rate, this is proportion of deaths in specified population during a period of time that are attributable to different causes. Next is number 57. Which of the following is the most prominent feature of public health nursing? A. It involves providing home care to sick people who are not confined in the hospital. B. Services are provided free of charge to people within the catchment area. C. The public health nurse functions as a part of a team providing public health nursing services. Or D. Public health nursing focuses on preventive, not curative services. The answer here is letter D. Public health nursing focuses on preventive, not curative services. Kasi public health nursing, we emphasize health promotion and disease prevention rather than just treating illness. Next is, pa-clear nga po yung 55. What do you mean pa-clear? Pa-screenshot or ito? Next ko na, number 5, yung sagot po. Ito yung definition niya po. According to C. Winslow, which of the following is the goal of public health? This is public health according to him po. These benefits as to, ito yung whole definition, pero andito lang taga sa last yung point niya. Next is number 50. 50 to 50. Okay, balik muna tayo ha. 50. Just quick screenshots lang. Ito yung 50. 1, 2, 3. Next ko na, number 51. And this is number 52. 58. A new public health nurse intends to give education through seminars and group discussion in her barangay. 58. Which disease was declared through Presidential Proclamation number 4 as a target for eradication in Philippines? A. Poliomyelitis. B. Measles. C. Rabies. D. Neonatal tetanus. Answer here, it's letter B. It's letter B. Measles. Presidential Proclamation number 4 is about Ligtas Tigdas program. This is when they launched the Philippine Measles Elimination Campaign. Next is number 59. The public health nurse is responsible for presenting the municipal health statistics using graphs and tables to compare the frequency of the leading causes of mortality in the municipality. Which graph will you prepare? A. Line. B. Bar. C. Pie. Or D. Scatter diagram. The answer here is letter B. Bar. Pag comparing data across different categories or time periods, it says frequency of leading causes of mortality. It's different causes of mortality, so different categories. So the best yung bar to use. Number 60. Which step in community organizing involves spotting for potential leaders in the community? A. Integration. B. Community organization. C. Community study. Or D. Core group formation. And the answer here is letter D, core group formation. Dito, nag-identify and recruit key individuals. Yung letter A, integration, bringing together different sectors, groups, and individuals in the community to work towards common goal. Yung community study, dito yung gather data information. Yung letter B is overall process, but it's also a step. Number 59. Wait, 59? Ito. It's a bar. 1, 2, 3. Okay. 61. Which step are plans formulated for solving community problems? A, mobilization, B, community organization, C, follow-up extension, or D, core group formation? The answer here is letter B, community organization. Plans formulate. Gawa muna ng plans dito. So, conduct series of assembly with the goals of arriving at a common understanding of the community's concerns and formulating a plan of action. Ang ingay. Hanggang NP2 tayo. Number 62. The public health nurse takes an active role in community participation. What is the primary goal of community organizing? A, to educate the people regarding community health problems. B, to mobilize the people to resolve community health problems. C, minimize the community's resources in dealing with health problems. Or D, maximize the community's resources in dealing with health problems. The answer here is letter D, maximize the community's resources in dealing with health problems. Test-taking strategies, two opposite choices, one of them is the correct answer. But also, ito naman talaga yung goal ng community organizing. Yung may use yung mga community resources. Number 63, an indicator in community organizing is when people are able to A, participate in community activities for the solution of a community problem. B, implement activities for the solution of the community problem. C, plan activities for the solution of the community problem. Or D, identify the health problem as a common concern. The answer here is letter A, participate in community activities for the solution of a community problem. Some may answer letter B, but guys, participation is the backbone of community organizing. So, hindi mangyayari itong B, C, and D if walang participation. Next is number 64. Tertiary prevention is needed in which stage of the natural history of disease? A, pre-pathogenesis, B, pathogenesis, C, prodromal, or D, terminal? The answer here is D, terminal. Kasi in tertiary prevention, rehabilitation, prevention of permanent disability, and disability limitation. Next is number 65. Administering BCG vaccine to a newborn belongs to what level of prevention? A, primary, B, secondary, C, intermediate, or D, tertiary? The answer here is letter A, primary. Pag primary prevention, this is to reduce the overall incidence and prevalence of diseases and health problems in a population. Screenshot na siya. And number 66. On the other hand, a woman undergoing pap smear test ordered by her OB-GYN is A, primary, B, secondary, C, intermediate, or D, tertiary. This is letter B, secondary. Pag detecting and treating a disease or the health problem in its early stages, it's secondary. Number 67, which type of family nurse contact will provide you with the best opportunity to observe family dynamics? A, clinic consultation, B, group conference, C, home visit, or D, written communication? It's letter C, home visit. Dynamics of a family relationship can be observed in their natural environment. Kasi baka if clinic consultation, sasabihin ni mommy na, we're working hand in hand in disciplining the kids. Tapos pag home visit mo and nag-ML lang si father, ganun. So, it's the best opportunity to observe family dynamics. Number 68. The typology of family nursing problems is used in the statement of nursing diagnosis in the care of families. The youngest child of the De Los Reyes family has been diagnosed as mentally retarded. This is classified as A, health threat, B, health deficit, C, foreseeable crisis, or D, stress point. The answer here is letter B, health deficit. Pag health threat, guys, potential risk or danger to the health or individual or family. So, unsafe neighborhood, environmental toxins, yan, health threat, yan. Yung foreseeable crisis, upcoming event or situation that is expected but may cause disruption in the family functioning. Yung stress point, unexpected event. So, death, ganun. Number 69. Ito. If you want to screenshot this one, you can screenshot. 1, 2, 3. Number 69. The De Los Reyes couple have a 6-year-old child entering school for the first time. The De Los Reyes family has A, health threat, B, health deficit, C, foreseeable crisis, or D, stress point. If you see questions like this and then you get confused kung foreseeable crisis or stress point, you ask yourself, is this expected from the family? It is expected for a child to enter school, so it's a foreseeable crisis. Number 70. Which of the following is an advantage of home visit? A, it allows the nurse to provide nursing care to a greater number of people. B, it provides an opportunity to do first-hand appraisal of the home situation. C, it allows sharing of experiences among people with similar health problems. Or D, it develops the family's initiative in providing for health needs of its members. The answer here is letter B. It provides an opportunity to do first-hand appraisal of the home situation. First-hand. Para kang witness dito. Yung letter C, this is advantage of group conference. Yung D, clinic consultation. Next is number 71. Which is contrary to the principles in planning a home visit? A home visit should have purpose or objective. B, the plan should revolve around family health needs. C, a home visit should be conducted in the manner prescribed by the IHU. Or D, planning of continuing care should involve a responsible family member. The answer is letter C. Hanap ng mali dito. A home visit should be conducted in the manner prescribed by the RHU. Home visit plan should be flexible and practical and should meet the needs of the family that you're visiting. Hindi based sa RHU. Number 72. The PHN bag is an important tool in providing nursing care during a home visit. The most important principle of bag technique states that it A, should save time and effort, B, minimize if not totally prevent the spread of infection, C, not overshadow concern for the patient and his family, or D, may be done in a variety of ways depending on the home situation, etc. Di ba dinadala siya in different houses? So, dapat letter B. Should minimize if not totally prevent the spread of infection. Next is number 73. To maintain the cleanliness of the bag and its contents, which of the following must the nurse do? A, wash his or her hands before and after providing nursing care to family members. B, in the care of family members, as much as possible, use only articles taken from the bag. C, put on an apron to protect her uniform and fold it with the right side out before putting it back into the bag. Or D, at the end of the visit, fold the lining on which the bag was placed, ensuring that the contaminated side is on the outside. And the answer here is letter A. Wash his or her hands before and after providing nursing care to the family members. Yung letter B, this goes against the idea of utilizing the family's resources. Ini-encourage yan ng CHNA, yung utilizing the family's resources. Yung letter C and D, this goes against the principle of asepsis and confining contaminated surface of objects. Number 74. The public health nurse conducts a study on the main causes of the high mortality rate due to heart disease in the municipality where she works. Which branch of epidemiology does the nurse practice in this situation? A. Descriptive, B. Analytical, C. Therapeutic, or D. Psychiatric? The answer here is letter B. Analytical. Yung analytical epidemiology, guys, it studies the factors or determinants affecting the disease. So, ang sabi dito, main causes of the high mortality rate. So, it's asking about factors. Yung descriptive, guys, it examines the time, place, and person involved in the disease. Yung letter C naman, therapeutic, this is about types of treatments being used. And yung psychiatric, concerned with the distribution of mental disorders in a population. Number 75. Which of the following is an epidemiologic function of the nurse during an epidemic? A. Conducting assessment of suspected clients in order to detect the communicable disease. B. Monitoring the condition of the cases affected by the communicable disease. C. Participating in the investigation to determine the source of the epidemic. Or D. Teaching the community on preventive measures against the disease. The answer here is letter C. Participating in investigation to determine the source of the epidemic. Yung conducting assessment, guys, this is a clinical function rather than epidemiologic function. Kasi in epidemiology, you study the patterns and determinants of health and disease sa population. So, in-involve niyan yung investigation to determine the source. Next is number 76. All of the following nursing interventions are correct when using the Z-track method of drug injection, except A. Prepare the injection site with the alcohol. B. Use a needle that's at least 1 inch long. B. Aspirate for blood before injection. Or D. Rub the site vigorously after the injection to promote absorption. The answer here is letter D. Rub the site vigorously after the injection to promote absorption. Kasi this may cause the medication to extravasate into the skin. Next is number 77. The correct method for determining the vastus lateralis site for IM injection, may answer na, sorry. Pero the answer here is letter D. Divide the area between the greater femoral trochanter and the lateral femoral condyle into thirds and select the middle third on the anterior of the thigh. Pwede ito siyang gawin, guys. The patient can be in supine or sitting position for an injection into this site. Number 78. The mid-deltoid injection site is seldom used for IM injections because it A. Can accommodate for only 1 ml or less of medication. B. Bruises too easily. C. Can only be used when the patient is lying down. Or D. Does not readily parenteral medication. Is not ready for parenteral medication. Answer here is letter A. Can accommodate only 1 ml or less of medication. Yung mid-deltoid injection site, it can only accommodate 1 ml or less because of its size and location, which is close to the brachial artery and radial nerve. Number 79. The appropriate needle size for insulin injection is A. 18 gauge, 1.5 inch long. B. 22 gauge, 1 inch long. C. 22 gauge, 1.5 inch long. Or D. 25 gauge, 5/8 inch long. Answer here is letter D. 25 gauge, 5/8 inch long. This is the recommended size for insulin injection because insulin is administered in sub-Q. Yung A, B, and C usually for IM. Next is number 80. The appropriate needle gauge for intradermal injection is A, 20, B, 22, C, 25, or D, 26. Intradermal only. Answer is letter D, 26. Kasi yung intradermal injection, it doesn't need to penetrate deeply into the skin. Kaya 26 gauge lang yung gagamitin. Next is number 81. Parenteral penicillin can be administered as A, IM injection or IV solution, B, IV or ID injection, C, intradermal or subcutaneous injection, or D, IM or a subcutaneous injection. And the answer here is letter A. Parenteral penicillin can be administered IM or added to a solution and given IV. Pero dito siya hindi siya pwede administer subcutaneously or intradermally. Ito sa 80, for those who want to screenshot, 1, 2, 3. And then sa 81. 1, 2, 3. 82, guys, there is another faulty question kasi walang nabigay na another given number. So I changed the question, but this is only hypothetical. The point here is to make sure that you know how to convert already. So example, the physician orders 60 grams of aspirin for a patient. On hand is 1 gram. The equivalent dose of milligrams is, this is letter B, 60,000 milligrams. Hypothetical ha, kasi hindi pwede mag-order 60 grams of aspirin. Pero you should know your conversion factors. Kasi normal lang yan, guys, na nalilimutan na yung 1 gram is 1,000 milligrams pala. Others think it's 100. Para hindi kayo magpanic sa exam. 83. The physician orders an IV solution of dextrose 5% in water at 100 ml per hour. What would the flow rate be if the drop factor is 15 drops per ml? A, 5 GTT per minute, B, 13 GTT per minute, C, 25 GTT per minute, or D, 50 drops per minute. Answer is C, 25 drops per minute. Ito yung flow rate na formula. 100 ml times 15 drops per ml, crush out yung ml, divided by 60 minutes, 25 drops per minute. Number 84. Situation, Barangay Conso Health Center regularly conducts Operation Timbang to assess the nutritional status of children. 84. The sex of the children included in this study will be classified as male and female. This measurement is, okay, 80 after this one. This is nominal. This pag words at category and no order like male, female, or colors, ganun siya, it's nominal. Pag interval, ito yung binibigay sa mga may negative, like weather, or temperature, ganun. Like negative 80 degrees Celsius. Pag ordinal naman with order, and then yung ratio naman, pag walang negative value like age, weight, and height. Next is number 85. Age belongs to what level of measurement? A, ratio, B, interval, C, ordinal, or D, nominal. Wala siyang negative. So this is letter A, ratio. Yung 86. Oh, wait, screenshot. 1, 2, 3. 86, the nutritional status of children is determined by weight and age. Weight is an example of what level of measurement? Same as age, this is also ratio. Kasi wala naman negative 10 kilograms, di ba? So, remember na guys, pag ratio, there's no negative value. 84. Okay, ha? Ito. 1, 2, 3. Okay. 87. The educational level of parents is also recorded with the possible choices given as elementary level, elementary graduate, high school level. The above set of choices is an example of what level of measurement? Ratio, interval, nominal, ordinal. This is ordinal. May order na siya. Number 88. Which of the following conditions may require fluid restriction? A. Fever, B. COPD, C. Renal failure, or D. Dehydration? The answer here is letter C, renal failure. Kasi nawawala na ng ability to eliminate waste and fluids yung kidney. Next is number 89. All of the following are common signs and symptoms of phlebitis except A. Pain or discomfort at the IV insertion site. B. Edema and warmth at the IV insertion site. C. A red streak exiting the IV insertion site. Or D. Frank bleeding at the insertion site. The answer here is letter D. Frank bleeding at the insertion site. Yung phlebitis, guys, ito yung mga signs and symptoms niya. Pain or discomfort, edema and warmth, red streak na sa IV insertion site, pero walang bleeding, frank bleeding. Number 90. The best way of determining whether a patient has learned to instill ear medication properly is for the nurse to A. Ask the patient if he or she has used eardrops before. B. Have the patient repeat the nurse's instructions using her own words. C. Demonstrate the procedure to the patient and encourage to ask questions. Or D. Ask the patient to demonstrate the procedure. The answer is just like what we do before, return demonstration. Kasi this provides the most certain evidence na nag-listen siya and alam niya paano gawin. So, effective yung patient teaching. Number 91, which of the following types of medications can be administered via gastrostomy tube? A. Any oral medications. B. Capsules. Whole contents are dissolved in water. C. Enteric-coated tablets are thoroughly dissolved in water. Or D. Most tablets designed for oral use except for extended duration compounds. And the answer here is letter D. Most tablets designed for oral use except for extended duration compounds. Yung capsules, enteric-coated tablets, tsaka extended duration, they should not be dissolved tapos administered via gastrostomy tube. Kasi ginawa yan sila, na-manufacture yan sila in these forms for a valid reason. Next is number 92. A patient who develops hives after receiving an antibiotic is exhibiting A. Drug tolerance, B. Idiosyncrasy, C. Synergism, or D. Allergy. The answer here is letter D. Allergy. Drug and yung letter, ito guys, yung katabi sa allergy, this is the definition for synergism. Yung synergism, drug interaction in which the sum of the drug's combined effects is greater than that of their separate effects. Yung tolerance, ito yung patient experiences decreasing physiologic response to repeated administration of the drug in the same dosage. And then yung idiosyncrasy, individuals' unique hypersensitivity to drug, food, or other substance. Number 93. Food fortification is one of the strategies to prevent micronutrient deficiency conditions. RA 8976 mandates fortification of certain food items. Which of the following is among these food items? A. Sugar, B. Bread, C. Margarine, or D. Filled milk. Answer is A. Sugar. RA 8976 mandates fortification of rice, wheat flour, sugar, and cooking oil. Tapos, yung nutrients ito is vitamin A, iron, and or iodine. Next is number 94. The nurse explains to a patient that a cough is A. A protective response to clear the respiratory tract of irritants. B. Primarily a voluntary action. C. Induced by the administration of an antitussive drug. Or D. Can be inhibited by splinting the abdomen. Answer here is A. It is a protective response to clear the respiratory tract of irritants. Next is number 95. An infected patient has chills and begins shivering. The best nursing intervention is to A. Apply iced alcohol sponges. B. Provide increased cool liquids. C. Provide additional bedcloths. Or D. Provide increased ventilation. Giniginaw na raw siya. So the answer here is letter C. Provide additional bedcloths. It helps equalize the body temperature and stop the chills. What is 93? Ito? Wait. Hindi ko siya masulat kasi naka-presenter view na ako. So, I'll just type it here. Dito sa notes ko. Yan siya. That is from the DOH website. Number 96. Situation, you will start working as a community health nurse in a far-flung barangay of Mindoro. The pathognomonic sign of measles is Koplik spot. You may see Koplik spot by inspecting the A. Nasal mucosa, B. buccal mucosa, C. Skin on the abdomen, or D. Skin on the antecubital surface. Answer is B. Buccal mucosa. Kasi Koplik spots may be seen on the mucosa of the mouth or the throat. 97. Among the following diseases, which is airborne? A. Viral conjunctivitis, B. Acute poliomyelitis, C. Diphtheria, or D. Measles. Answer here is D. Measles. Yung viral conjunctivitis may be direct or indirect contact with the discharges from the infected eyes. Yung acute poliomyelitis through the fecal-oral route and with contact with throat secretions. Tapos yung diphtheria, direct or indirect contact with respiratory secretions. 98. Among children aged 2 months to 3 years, the most prevalent form of meningitis is caused by which microorganism? A. Haemophilus influenzae, B. morbillivirus, C. Streptococcus pneumoniae, or D. Neisseria meningitidis. Ma'am, is COVID po ba airborne or droplet na po? Wala talaga akong confidence when it comes to COVID, but when I was studying for the November 2022 boards, I was my answer was we were taught to answer droplet. A droplet ba yun? Yeah, droplet. But now na nag-NCLEX ako, guys, pwede siyang ma-belong sa airborne or droplet. So, still very confusing. See, consider na daw po as airborne. So, pwede rin siya. Now that I'm studying for NCLEX, it could be considered airborne or droplet. Next is number 90. Ay, wala pang answer dito. 98 is A. Haemophilus influenzae. Okay. Yung morbillivirus, measles, this is known as measles virus, and this can cause meningitis as a rare complication of measles infection. Pero this is seen in older children, less common in 2 months to 3 years. Yung Streptococcus pneumoniae naman, less prevalent than the Haemophilus influenzae in this group. Same with Neisseria meningitidis. More commonly seen in older children and adults yung Neisseria meningitidis. Number 99. The use of larvivorous fish in malaria control is the basis for which strategy of malaria control? A. Stream seeding, B. Stream clearing, C. Destruction of breeding places, or D. Zoo prophylaxis. Answer here is A. Stream seeding. Stream seeding, this is done by putting tilapia fries in stream or other bodies of water identified as breeding places for the Anopheles mosquito. What do you mean meaning nung diphtheria? Like what is diphtheria or wait, proceed muna tayo ha. Number 100. Mosquito-borne diseases are prevented mostly with the use of mosquito control measures. Which of the following is not appropriate for malaria control? A. Use of chemically treated mosquito nets. B. Seeding of breeding places with larva-eating fish. C. Destruction of breeding places of the mosquito vector. Or D. Use of the mosquito-repelling soaps such as those with basil or citronella. And the answer here is letter C. Kasi yung Anopheles mosquitoes, they breed in slow-moving clear water such as mountain streams. So hindi enough na i-destroy lang yun. Yung ratio, guys, I got confused with that true zero or no true zero. So ganito na lang yung pagkaka-explain ko sa inyo. Pag ratio, guys, walang negative. It is numerical na walang negative. For example, age and weight. So you can't say he is negative 10 years old, diba? So if that's ratio. Pag interval, this is used pag may negative yung nasa situation. Yung Anopheles mosquitoes, nagbe-breed sila sa slow-moving clear water, yung mga mountain streams. Sa mountain streams, di ba? Ang sabi kasi dito, destruction of breeding places of the mosquito vector. Sa mountain streams sila nagbe-breed, guys. So hindi siya appropriate, hindi siya enough. Not like using chemically treated mosquito nets or seeding of breeding places. So, okay. We're done with NP1. We'll have another 10-minute break. Balik ulit kayo, 7. 8 na lang, guys. 8 na. 8. Kasi we finished a little bit early. So, balik tayo 8. Ma'am, what do you mean by negative pag-interval? Pwede na kayo mag-break, ha? What do you mean by negative pag-interval? Di ba? For example, they are asked, anong number nga yun? Ito. Level of measurement, di ba? If it says it asks about temperature. Like, anong level of measurement ang temperature? Yung temperature ng Cagayan de Oro is ganito, ganyan. You can have a negative value of the temperature. So, it is interval. Pag interval, mayroon siyang negative value. So, yung age, hindi siya pwede sa interval kasi walang negative 10 years old. Guys, ang daming nag-ask if pwede ba ako mag-share ng notes. Guys, yung notes ko, literal logbook. And then, like, sobrang pangit ang penmanship ko. So, dito lang ako nag-review sa Cagayan de Oro kasi hindi ko carry ang hindi face-to-face. Face-to-face ako sa Top Rank Cagayan. Guys, wait lang muna, guys. I need to take a break. CR break muna ako, guys. Wait lang talaga. Hi guys. So, I'll proceed na lang guys ha. Kasi I know that you will still study after this one. So, if we're gonna finish early, baka meron pa kayong more time to study. Okay? So, let's start with NP2 ratio. This is for equals 9. Number 1. Situation 1, there is a rotation in the hospital for trainee nurses where Nurse Betty is working. Nurse Betty is assigned in the labor and delivery unit. Number 1, the amniotic fluid of a client has a greenish tint. The nurse interprets this to be a result of which of the following? A. Lanugo, B. Hydramnio, C. Meconium, or D. Vernix. Guys, this is meconium. Ito yung sticky, dark green early stool that is passed by a newborn soon after birth. It is sometimes naman tarry black. Okay, dark green or tarry black. Yung vernix, ito yung white creamy naturally occurring biofilm covering the skin of the fetus. Lanugo, yan yung hair. And then yung hydramnio, it's a condition na too much amniotic fluid. Number 2. A client has delivered a child at 28 weeks gestation. The nurse would expect the newborn to exhibit which of the findings? A. Bones are fully developed. B. Eyes are developed and open. C. Lanugo is beginning to disappear. Or D. Lungs are completely mature. The answer here is letter B. Eyes are developed and open. At 28 weeks gestation, the newborn should have the ability to perform gas exchange if needed and then open eyes. Mali to, yung 23. This is 32. Ay, pangit. Sorry. Yan. Bones are not fully developed until 32 weeks of gestation. Yung lanugo naman, it begins to disappear at 36 weeks gestation. Tapos yung lungs, fully mature at 36 to 38 weeks. Number 3. A client in labor at 38 weeks gestation was admitted to the labor and delivery unit. As the client was walking around the hallway, she told the nurse that her water broke. Which of the following should the nurse do first? A. Check the color of the amniotic fluid. B. Escort the client to the labor room and assess fetal heart rate. C. Have the client lie on the bed and check vital signs. Or D. Escort the client to the labor room and notify the physician. The answer here is letter B. Ba't ayaw? Letter B. Escort the client to the labor room and assess FHR. Yung water broke, guys, di ba? Ito yung spontaneous rupture of the fetal membranes, tas may loss of amniotic fluid. The umbilical cord can prolapse. So, if ma-compress by the fetus, it can cause fetal bradycardia. So, when the membranes rupture, you should first assess the fetal heart rate to determine fetal stability. Next is number 4. A nurse is teaching a postpartum client about cord care for the newborn. Which statement by the client indicates a need for further teaching? So, hanap ng mali. A. I will secure the diaper over the cord to protect it. B. I can expect the cord to turn black in a few days. C. I will give my newborn sponge baths until the cord falls off. Or D. I should let the cord fall by itself. Ang mali dito is letter A. I will secure the diaper over the cord to protect it. Keep the diapers folded below, not over the cord, to keep it dry and prevent contamination. Okay lang mag-give ng newborn sponge baths with warm water. Next is number 5. The nurse should make which statement to a pregnant client found to have gynecoid pelvis? A. Your type of pelvis has narrow pubic arch. B. Your type of pelvis is the most favorable for labor and birth. C. Your type of pelvis is a wide pelvis but it has a short diameter. Or D. You will need a cesarean section because this type of pelvis is not favorable for a vaginal delivery. The answer here is letter B. Your type of pelvis is the most favorable for labor and birth. Yan yung gynecoid. Yung letter A, yung android pelvis, or if lalabas sa boards, resembles a male pelvis, it has narrow pelvic plane, so unfavorable siya. Yung anthropoid pelvis naman, may narrow pubic arc. And then yung platypeloid pelvis has a wide transverse diameter. Pero yung anterior-posterior diameter niya, like front to back diameter, is short. So, inadequate pa rin. Ito, you can screenshot this one. 1, 2, 3. And next, situation 2. Nurse Augustine is handling patients who are high risk during their pregnancy. The nurse is assisting with the vaginal delivery of a full-term infant. Which assessment finding of the newborn is most important for the nurse to follow up? A. Flat bluish discolored area on the buttocks. B. Localized soft tissue edema of the scalp. C. Small amount of whitish substance in axilla. Or D. Tuft of hair at the base of the spine. Okay, balik ko yung pelvis after this one. Answer is this one. Letter D. Kasi ito guys, a tuft of hair may be seen over the site sa spina bifida. This is a defect in which the spinal cord contents can protrude through the vertebrae nga hindi nag-close. Yung letter A, these are Mongolian spots. Letter B naman, caput succedaneum or danium, localized soft tissue edema of the scalp from the prolonged pressure of the head against the mother's cervix during labor. It will resolve within the first week of life. Ito guys, may nagsend na ng pelvis na screenshot. And then yung vernix caseosa naman, sebaceous gland that covers the fetus during pregnancy. Number 7. A nurse is caring for a client who is about to undergo an emergency cesarean birth for severe preeclampsia at 26.3 weeks gestation. The client is admitted after 3 days of a severe headache and a 10-pound weight gain. Her blood pressure is 180/110 mmHg and she has a moderate abruption. The woman states, "It's my fault. If I would have called earlier, they could have stopped it and I wouldn't be having my baby delivered now." What is the nurse's best response? A. This is not your fault. You are here now and we are going to take care of you. B. Earlier intervention might have deemed a better outcome, but you can't think of that now. C. Your baby is going to be fine. Or D. Your health and well-being are what is important. You need to think of yourself and not the baby right now. The answer here is letter A. Guys, may theracom sa lahat ng NPs. So, read the situation well. Yung letter A kasi, this gives reassurance. Nagkaka-severe preeclampsia na siya, guys. So, you should, by any means, lessen her stress. Yung letter B, suggesting that an earlier presentation would have produced a better outcome, nagbe-blame ka eh. So, mas stress siya. Yung letter C naman, false reassurance. And then yung letter D, it's insensitive to say na wag ka munang mag-think sa baby mo right now. Number 8. A pregnant client is seen for regular prenatal visit and tells the nurse that she is experiencing irregular contractions. The nurse determines that she is experiencing Braxton Hicks contractions. On the basis of this finding, which nursing action is appropriate? A. Contact the primary healthcare provider. B. Instruct the client to maintain bed rest for the remainder of the pregnancy. C. Inform the client that these contractions are common and may occur throughout the pregnancy. Or D. Call the maternity unit and inform them that the client will be admitted in a preterm labor condition. And the answer here is letter C. Inform the client that these contractions are common and may occur throughout the pregnancy. Kasi yung Braxton Hicks contractions, guys, they are even normal in some pregnant women during pregnancy. So there's no reason to notify the primary healthcare provider. Next is number 9. The nurse is performing a postpartum assessment 12 hours after the prolonged vaginal delivery of a term infant. Postpartum 12 hours. Which assessment finding should be reported to the healthcare provider? So ano yung medyo dangerous dito? A. Complaints of discomfort during fundal palpation. B. Foul smelling lochia. C. Oral temperature of 37.7. Or D. White blood cell of 20,000. The answer here is letter B, foul-smelling lochia. Kasi, a foul-smelling lochia, this may suggest endometrial infection. Ang sabi kasi dito guys, prolonged vaginal delivery. So, this prolonged vaginal delivery brings her to an increased risk of infection. Yung letter A, palpation of the postpartum uterine fundus, commonly uncomfortable yan sa client. Yung letter C and D, letter C muna. Temperature is normally elevated sa first 24 hours postpartum. And then yung sa letter D naman, normally elevated din first 24 hours postpartum. Next is number 10. When assessing a client at 12 weeks gestation, the nurse recommends that she and her husband consider attending childbirth preparation classes. When is best time for the couple to attend these classes? Childbirth preparation. A. 16 weeks of gestation. B. 20 weeks of gestation. C. 24 weeks of gestation. Or D. 30 weeks of gestation. Yung pinakamalapit na, like third try, letter D, 30 weeks of gestation. Kasi, ito yung closest and the parents would be ready for such classes. Not 16, not 20, and not 24. Number 11. In developing a teaching plan for expectant parents, the nurse decides to include information about when the parents can expect the infant's fontanelles to close. Which statement is accurate regarding the timing of closure of an infant's fontanelles that should be included in this teaching plan? A. The anterior fontanelle closes at 2 to 4 months and the posterior fontanelle by the end of first week. B. Anterior fontanelle 5 to 7 months and posterior fontanelle by the end of second week. C. The anterior fontanelle closes at 8 to 11 months and the posterior fontanelle by end of the first month. Or D. The anterior fontanelle closes at 12 to 18 months and the posterior fontanelle by the end of the second month. The answer here is letter D. The anterior fontanelle closes at 12 to 18 months and the posterior fontanelle by the end of the second month. Number 12. When preparing a class on newborn care for expectant parents, which is correct for the nurse to teach concerning the newborn infant at term gestation? A. Milia are red marks made by forceps and will disappear within 7 to 10 days. B. Meconium is the first stool and usually yellow-gold in color. C. Vernix is a white cheesy substance predominantly located in the skin folds. Or D. Pseudostrabismus found in newborns is treated by minor surgery. And the answer here is letter C. Vernix is a white cheesy substance predominantly located in the skin folds. Milia, those are not red marks made by forceps. Those are white pinpoint spots sa nose and chin. Yung letter B naman, it's tarry black or dark green, not yellow. And yung pseudostrabismus, in layman's term, crossed eyes, this is normal after birth. Next is 13. A nurse receives a shift change report for a newborn who is 12 hours post-vaginal delivery. In developing a plan of care, the nurse should give the highest priority to which finding? A. Cyanosis at the hands and feet. B. Skin color that is slightly jaundiced. C. Tiny white papules on the nose and chin. Or D. Red patches on the cheek and trunk. And the answer here is letter B. Yes, ayaw. Pathologic jaundice. Skin color that is slightly jaundiced. Kasi, this should be further evaluated in a newborn less than 24 hours old. Yung acrocyanosis, it is a common finding in newborns because the capillary system is immature, di ba? Yung milia naman, caused by sebaceous gland blockage. Tapos magdi-disappear lang yan in a few weeks. Tapos yung red patches, those are erythema toxicum neonatorum. Common lang yan sa newborns. Number 14. Wait. A new mother who has just had her first baby says to the nurse, I saw the baby in the recovery room. She sure has a funny-looking head. Which response by the nurse is best? A, this is not an unusually shaped head, especially for a first baby. B, it may look odd, but newborn babies are often born with heads like that. C, that is normal. The head will return to a round shape within 7 to 10 days. Or D, your pelvis was too small, so the head had to adjust to the birth canal. And the answer here is letter C. That is normal. The head will return to a round shape within 7 to 10 days. Nagre-reassure ka dito and giving correct information. Yung letter A, although correct, may subtle implication siya ng don't worry. Yung letter B naman, medyo condescending or dismissing. Tapos yung letter D, negative statement siya and implies the mother's fault because of the birth canal. Number 15. Sorry. Number 15, an expectant father tells the nurse he fears that his wife is losing her mind. He states that she is constantly rubbing her abdomen and talking to the baby, and that she actually talks to the baby as if it can understand her. Which recommendation should the nurse make to this expectant father? A, suggest that his wife seek professional counseling to deal with her symptoms. B, explain that his wife is exhibiting ambivalence about the pregnancy. C, ask him to report similar abnormal behaviors at the next prenatal visit. Or D, reassure him that normal maternal-fetal bonding is occurring. Medyo judger si father. This is actually normal maternal-fetal bonding. This does not reflect ambivalence. So no intervention is needed, and then not necessary yung professional counseling. Number 16. Situation 3. Nurse Tyler is a newly hired nurse. He has always been very interested in taking care of newborn babies. 16. Prior to discharging a 24-hour-old newborn, the nurse assesses her respiratory status. Which of the following would the nurse expect to assess? A. Respiratory rate 45, irregular. B. Costal breathing pattern. C. Nasal flaring rate of 65. And D. Crackles on auscultation. And the answer here is letter A. Respiratory rate of 45, irregular. Ang typical respirations of a 24-hour-old newborn is symmetric, slightly irregular, shallow, and unlabored at a rate of 30 to 60 breaths per minute. Next is number 17. When explaining how a newborn adapts to extrauterine life, the nurse would describe which body systems as undergoing the most rapid changes. A. Gastrointestinal and hepatic. B. Urinary and hematologic. C. Respiratory and cardiovascular. Or D. Neurological and integumentary. The answer here is letter C. Respiratory and cardiovascular. Although lahat ng body systems, they will undergo changes, yung respiratory gas exchange, tapos circulatory system, or cardiovascular system, they must occur immediately para makasustain sa extrauterine life. Number 18. Which anticipatory guidance action by the nurse makes the role transition to parenthood easier? A. Help the new parents identify resources. B. Recommend employing babysitters frequently. C. Tell the parents about the realities of parenthood. Or D. Offer a home phone number and tell parents to call if they have a question. The answer here is letter Letter A, help parents identify resources. Kasi available resources na nasa community can assist the parents in their role transition. May iba, yung letter B, hindi lahat nakaka-afford ng babysitters. Letter C naman, each adult have different perceptions of parenthood. And you might say things na might scare them. Mas natatakot sila. So, better say, don't give your own reality of parenthood. They have their different reality dyan. Offer a home phone number and tell parents to call if they have a question naman. The nurse should not give her personal number. Next is number 19. 20 minutes after birth, a baby begins to move his head from side to side, making eye contact with the mother and pushes his tongue out several times. The nurse interprets this as A, a good time to initiate breastfeeding, B, the period of decreased responsiveness preceding sleep, C, the need to be alert for gagging and vomiting, or D, evidence that the newborn is becoming chilled. Yung pushes his tongue out several times, guys, this is the best clue here. This is a good time to initiate breastfeeding. Number 20. A new mother is changing the diaper of her 20-hour-old newborn and asks why the stool is almost black. Which response by the nurse would be most appropriate? A, it must be something you ate during your pregnancy. B, this is meconium stool, normal for a newborn. C, I'll take a sample and check it for possible bleeding. Or D, this is unusual and I need to report this. Answer is letter B. This is meconium stool, normal for a newborn. Like I said, meconium is greenish, black, and tarry and usually pass within 12 to 24 hours at birth. The screenshot dito. 1, 2, 3. Tapos sa 19. Ano to? Ilang days po? I think 1 week. Like after 1 week, it should no longer be black. I think the safe number is 1 week. Number 20. A new mother is changing the diaper of her 20-hour-old newborn and asks why the stool is almost black. Which response by the nurse would be most appropriate? A, it must be something you ate during pregnancy. B, this is meconium stool, normal for newborn. C, I'll take a sample and check it for possible bleeding. Or D, this is unusual and I need to report this. This is letter B. Meconium stool, normal for newborn. Joke, sorry, nabasa ko na ito pala. Number 21. Sorry. Number 21, which of the following would alert the nurse to a possibility of respiratory distress in newborn? A, symmetrical chest movements. B, periodic breathing. C, respirations of 40 breaths per minute. Or D, sternal retractions. Answer here is letter D, sternal retractions. Ito guys, yung signs of respiratory distress, screenshot in a newborn. Sternal retraction, cyanosis, tachypnea, expiratory grunting, nasal flaring. Some newborns, they may show periodic breathing, like Myles, like mag-stop, mga 5 to 10 seconds, then balik ulit. Number 22. When counseling a mother about the immunologic properties of breast milk, the nurse would emphasize breast milk as a major source of which immunoglobulin? A, IgA, B, IgG, C, IgM, or D, IgE? This is letter A. Diba? Gatas. A major source of IgA is human breast milk. Yung IgG, this crosses the placenta beginning at approximately 20 to 22 weeks gestation. IgM, generally low at birth unless there is congenital intrauterine infection. Or D, and yung D, it does not play a major role in the defense of the newborn. Number 23, a postpartum adolescent mother confides to the nurse that she hopes her baby will be good and sleep through the night. What should the nurse plan to teach the client to do? A. Talk softly and cuddle her baby when crying occurs. B. Keep her baby awake for longer periods during the day. C. Ensure sleep by adding cereal to her baby's bedtime bottle. Or D. Put a soft and brightly colored toy next to her baby at bedtime. And the answer here is letter A. Talk softly and cuddle her baby when crying occurs. So you need to teach them about different infant behaviors and how to cope with them. Like holding and talking to the infant for console para magpakalma. Yung letter B, this is unhealthy. Yung i-disrupt mo yung sleeping pattern ni baby. Letter C naman, the baby is too young to be given cereal. And then letter D, put a soft, brightly colored toy next to the baby. Hindi siya, this is not meaningful. Tapos parang ginagawang substitute for parental attention. Number 24. A pregnant client is making her first antepartum visit. She has a 2-year-old son born at 40 weeks, a 5-year-old daughter born at 38 weeks, 7-year-old twin daughters born at 35 weeks, and she had a spontaneous abortion 3 years ago at 10 weeks. Using the GT-PAL format, the nurse should identify the client is letter C, G5, T2, P1, A1, and L4. Screenshot niyo mga guys. 1, 2, 3. Number 25. The client tells the nurse that her last menstrual period started on May 8 and ended on May 13. Using Nagel's rule, the nurse determines her EDD to be which of the following? A. February 20, B. February 1, C. January 20, and D. February 15. And the answer here is letter D. Letter D. February 15. Guys, I really don't use this. A lot of people use this one. Pero mas nakaka-confuse siya eh. So, what I do is I just add 9 months. And then, diretso na yung years. Add 9 months, add 7 days, plus 9 plus 7. Di ba? Kasi if you do this, like if January to March, then don't add any year, mas nakaka-confuse. So, example, this one. Last menstrual period started on May 8. So, May, add ka 9 months. May, June, July, August, September, October, November, December, January, February. So, February, and 8 plus 7, 15. Yan lang. Next is number 26. Situation 4. Nurse 30 and the rest of the labor and delivery unit is preparing for the day's work. A surge of pregnant women have arrived at the very first hour of their shift. 26. A multigravida at 37 weeks gestation arrives at the emergency room with painless bright red bleeding and mild contractions every 7 to 10 minutes. Which of the following assessments should be avoided? A. Maternal vital sign. B. Fetal heart rate. C. Contraction monitoring. Or D. Cervical dilation. Ito yung symptoms niya guys ha. Painless bright red bleeding. And the answer here is letter D. Because this indicates placenta previa. And wag na wag kayo gagawa ng IE or vaginal exam if there is suspected placenta previa. Assessing maternal vital signs, makaka-help naman siya sa physiologic status, like determining or monitoring. Yung fetal heart rate naman to assess fetal well-being, and it should be done. Monitoring contractions, this will help evaluate the progress of labor. Number 27. A pregnant client in the first trimester calls the nurse at a healthcare clinic and reports that she has noticed a thin, colorless vaginal drainage. The nurse should make which statement to the client? A. Come to the clinic immediately. B. The vaginal discharge may be bothersome but is a normal occurrence. C. Report to the emergency department at the maternity center immediately. Or D. Use tampons if the discharge is bothersome, but be sure to change the tampons every 2 hours. Answer here is letter B. The vaginal discharge may be bothersome, but it is a normal occurrence. This is called leukorrhea, which begins during the first trimester. This is thin, colorless, yellow vaginal discharge, and it happens throughout the pregnancy. May iba na bother, pero this doesn't require any visit to the ER or doesn't need to report sa doctor. Don't use tampons kasi it increases the risk of infection. Pwede mag-use ng panty liner but not tampons. 28. During labor, a client who has been receiving epidural anesthesia has a sudden episode of severe nausea, and her skin becomes pale and clammy. What is the nurse's immediate reaction? A. Turn the client on her side. B. Notify the healthcare provider. C. Check the vaginal area for bleeding. Or D. Monitor the fetal heart rate every 3 minutes. The answer is A. Turn the client on her side. Kasi one common complication of epidural anesthesia is maternal hypotension. So, pag i-turn mo siya sa side, tapos ma-deflect yung uterus from putting pressure sa inferior vena cava, then baka magiging okay siya. Tapos, only notify if the symptoms do not change. Yung letter C, hindi specific observation after epidural anesthesia yung checking vaginal area for bleeding. Next is number 29. A nurse observes a laboring client's amniotic fluid and decides it is the expected color. With what description of the amniotic fluid supports this conclusion? A. Clear, dark amber and contains shreds of mucus. B. Straw-colored, clear and contains little white specks. C. Milky greenish yellow and contains shreds of mucus. Or D. Greenish yellow, cloudy and contains little white specks. The answer here is letter B. Straw-colored, clear and contains little white specks. Next is number 30. A nurse is assigned to an adolescent who gave birth 12 hours ago. She continually talks on the phone to her friends and does not respond when her new baby cries. What is the best immediate intervention? A. Calling social service for a consult. B. Calling the psychiatric team for an intervention. C. Calling her mother and having her speak with the client. Or D. Modeling appropriate behaviors that encourage infant bonding. Answer here is letter D. Modeling appropriate behaviors that encourage infant bonding. Kasi all women, they really go through several phases of adapting to the role of a mother. Kahit anong preparation pa yan, mayroon talaga silang phases na they will go through. So what you can do is model appropriate behavior. So tell them that give attention. No need to call for social service, not needed this early. And yung psychiatric team, not necessary din. Next is number 31. What is the best nursing intervention to minimize perineal edema after an episiotomy? A. Applying ice packs. B. Offering warm sitz baths. C. Administering aspirin PRN. D. Elevating the hips on a pillow. And the answer here is letter A, applying ice packs. Kasi yung cold, this causes vasoconstriction. So this reduces edema by lessening accumulation of blood at the episiotomy site. Heat therapy alone, itong offering warm sitz baths. Heat therapy alone, it doesn't resolve the perineal edema. Tapos yung administering aspirin, contraindicated in the early postpartum period because of the risk of hemorrhage. Tapos yung elevating the hips on a pillow, it only provides minimal relief. Number 32. A nurse teaches a postpartum client how to care for her episiotomy to prevent infection. Which behavior indicates that teaching was effective? A. The perineal pad is changed twice daily. B. She washes her hands whenever a perineal pad is changed. C, she rinses her perineum with water after using an analgesic spray. Or D, the perineum is cleansed from the anus towards the symphysis pubis. And the answer is letter B. She washes her hands whenever a perineal pad is changed. This prevents the transfer of microorganisms. Yung twice daily, guys, inadequate number of changes yan. Dapat at least every 4 hours, they're changing of pad. Kahit hindi yan puno, change talaga. Rinsing the perineum with water after using an analgesic spray, it interferes with the analgesic action and it does not prevent infection. And then yung letter D naman, dapat the other way around. Kasi this promotes contamination of the vagina and urethra by organisms from the anal area. Number 33. Number 33, a client in labor begins to experience contractions 2 to 3 minutes apart that last about 45 seconds. Between contractions, the nurse identifies a fetal heart rate of 90 beats per minute on the internal fetal monitor. What is the next nursing action? A, notify the healthcare provider. B, resume continuous fetal heart monitoring. C, continue to monitor the maternal vital signs. Or D, document the fetal heart rate as an expected response to contractions. Answer here is letter A. Notify the healthcare provider. Kasi guys, 90 beats per minute, this is already bradycardia. This indicates the fetus may be compromised, requiring medical intervention. Number 34. A nurse examines a client who had a cesarean birth. It is 3 days since the birth and the client is about to be discharged. Where does the nurse expect the fundus to be located? A, 1 finger breadth below the umbilicus. B, 2 finger breadths below the umbilicus. C, 3 finger breadths below the umbilicus. Or D, 4 finger breadths below the umbilicus. And the answer is letter C, 3 finger breadths below the umbilicus. Kasi the fundus, it descends 1 finger breadth per day from the first postpartum day. Number 35. A client on the postpartum unit asked the nurse why the nurses are always encouraging her to walk. What should the nurse consider when forming a response in language the client will understand? A, respirations are enhanced. B, bladder tonicity is increased. C, abdominal muscles are strengthened. Or D, peripheral vasomotor activity is promoted. Guys, ito, another error here. Like, this is my error talaga. I'm sorry. The real answer here talaga, guys, is letter D. Ang naka-confuse lang dito is, it says kasi na forming a response in language. Pero you will encourage her to walk for the peripheral vasomotor activity that is promoted. Okay. Yung letter C, guys, abdominal muscles are strengthened. The exercise kasi during the next 6 weeks, yan yung nakaka-strengthen sa abdominal muscles. Next is number 36. Situation 5, despite the numerous e-health teachings, high-risk pregnancies are inevitable. Different cases of high-risk pregnancies always keep the labor and delivery unit of JTA Hospital. 36, a client is receiving magnesium sulfate therapy for severe preeclampsia. What initial sign of toxicity should alert the nurse to intervene? A, hyperactive sensorium. B, increase in respiratory rate. C, lack of the knee-jerk reflex. Or D, development of a cardiac dysrhythmia. Always remember, guys, magnesium, it has a CNS depressant effect. So if too much magnesium, so too much depression, so low. The answer here is C, lack of the knee-jerk reflex. Toxic levels will be reflected by the loss of this one. Letter A, the level of consciousness, it should be decreased if may toxicity nito. Tapos, there is decrease of the respiratory rate, not increase. And then yung development of cardiac dysrhythmia, this is related sa potassium. Number 37, a client at 9 weeks gestation asked the nurse in the prenatal clinic if she can have her chorionic villi sampling done at this visit. At what week gestation should the nurse respond is the best time for this test? A, 8 weeks and less than 10 weeks. B, 10 weeks and less than 12 weeks. C, 12 weeks and less than 14 weeks. Or D, 14 weeks and less than 16 weeks. And the answer here is letter B, 10 weeks and less than 12 weeks. This is the ideal time for chorionic villi sampling. This allows the client to consider other options if a problem is discovered. The next, number 38. A nurse is assessing a client with tentative diagnosis of hydatidiform mole. Which clinical finding should the nurse anticipate? A, hypotension. B, decreased fetal heart rate. C, unusual uterine enlargement. Or D, painless heavy vaginal bleeding. And the answer here is letter C, unusual uterine enlargement. Yung proliferation of trophoblastic tissue, mas grabe yung enlargement niya more quickly compared if a fetus was growing in the uterus. Letter A, it should be hypertension, not hypotension, that occurs with molar pregnancy. Letter D naman, there may be slight vaginal bleeding. And then yung letter B, there is no fetus within a hydatidiform mole. Number 39. Sonography of a primigravida who is at 15 weeks gestation reveals a twin pregnancy. The nurse reviews with the client the risks of multiple pregnancy that were explained by the healthcare provider. Which condition does the client identify that indicates the need for further instruction about complications associated with multiple gestation? A, preterm birth. B, Down syndrome. C, twin-to-twin transfusion. Or D, gestational hypertension. Hanap tayo ng mali dito. The answer here is letter B, Down syndrome. Chromosomal anomalies are not associated with multiple gestation. Therefore, the clients need further instructions. Yung preterm birth with multiple gestation, this occurs for a variety of reasons, such as spontaneous rupture of the membranes, abruptio placentae, or marked uterine, distension. Yung letter C naman, shunting of blood between placentas can occur with a multiple gestation. And then yung letter D, if there are multiple gestation, if there are multiple placentas. And then yung letter D, the increased blood volume and metabolism is necessary to sustain a multiple gestation, predispose a client to hypertension. Number 38. Okay. Ito siya. Ma'am, H mole po ba is considered pregnancy? It is also called molar pregnancy. So maybe, basta the other term of H mole is molar pregnancy. Pero walang fetus. Counted po sa GT-PAL? No. Sa GT-PAL. I think no sa G. No sa G. No. Kasi there's no fetus. Number 39. Hanggang NP2 lang, don't worry. Last na to. Number 40. A nurse is reviewing the obstetric history of a client who had an abruptio placentae. What prenatal condition does the nurse expect the client to have had? Abruptio placentae. A. Cardiac disease, B. Hyperthyroidism, C. Gestational hypertension, or D. Cephalopelvic disproportion. Answer here is letter C, gestational hypertension. Kasi the hypertension during pregnancy, this leads to vasospasms, leading to placenta detaching from the uterine wall. Yung letter A, guys, cardiac disease, it doesn't really cause abruptio placentae. Tapos yung letter B, endocrine disturbance yan, pero it doesn't affect the placenta. And then letter D, this may affect the birth of the fetus but not the placenta. Number 41. Screenshot na ha. Number 41. A client arrives at the hospital at 38 weeks gestation with profuse vaginal bleeding. She states that it occurred suddenly without any contractions. Which condition may the client be experiencing that requires immediate notification of the healthcare provider? Suddenly without any contractions. A. Placenta previa, B. Placenta accreta, C. Ruptured uterus, or D. Concealed abruptio. The answer here is A. Placenta previa. Classically painless bleeding, hindi niya napansin. The placenta is partially or covering the cervical os. Yung placenta accreta, the placenta attaches through the endometrium to the myometrium. Hindi ruptured uterus kasi painful occurrence too, and it says hindi niya napansin. And then, yung concealed abruptio, there is no visible bleeding if the abruptio is concealed. And then, painful yung abruptio. Number 42, when is it most important for a female to know that a fetus may be structurally damaged by the ingestion of drugs? A, during early adolescence, B, throughout the entire pregnancy, C, when planning to become pregnant, or D, at the beginning of the first trimester. The answer here is letter C, when planning to become pregnant. Kasi, the greatest danger of drug-induced malformations is in the first trimester of pregnancy during the period of organogenesis. Tapos, a woman may not know she is pregnant, so she should be aware before becoming pregnant. Yung letter B, guys, yes, it should be avoided throughout the pregnancy, pero yung sa first trimester talaga, the period of organogenesis is most critical. So, dapat, before pa lang sila naggawa ng baby, alam na niya yung damage ng drugs. Number 43, a client at 10 weeks gestation calls the clinic and tells the nurse that she has morning sickness and cannot control it. What should the nurse suggest to promote relief? A, eat dry crackers before arising. B, increase fat intake before bedtime. C, drink high carbohydrate fluids with meals. Or D, have two small meals a day with snack at noon. The answer here is letter A, eat dry crackers before arising. Nausea and vomiting, nangyayari siya in almost 50% of all pregnancies. So, eating dry crackers before getting out of bed is a simple remedy. Kasi the sodium bicarbonate in the crackers will help settle the gastric acid. Yung letter B naman, it does not relieve the nausea, yung increased fat intake. Letter C, this is not helpful. Yeah, separating fluids from solids at mealtime, mas advisable siya. Letter D naman, this does not meet the nutritional needs of a pregnant woman. Number 44, a client tells a nurse in a prenatal clinic that she has vaginal staining but no pain. Her history reveals amenorrhea for the last 2 months and pregnancy confirmation after her first missed period. She has admitted to the high-risk unit because she may be having spontaneous abortion. What type of abortion is suspected? A, missed, B, inevitable, C, threatened, or D, incomplete. This is very good. This is threatened. Spotting in the first trimester may indicate that the client is having threatened abortion. Yung letter A, missed abortion, this may not cause any outward signs or symptoms. Just that, the signs of pregnancy disappear. Yung letter B naman, yung inevitable abortion, it can only be confirmed if vaginal exam reveals cervical dilation. Yung letter D naman, not all products of conception has been expelled. Number 45. A nurse is assessing a pregnant client during the 3rd trimester. What clinical finding is an expected response to the pregnancy? A. Tachycardia. B. Dyspnea at rest. C. Progressive dependent edema. Or D. Shortness of breath on exertion. Expected response. Letter D. Shortness of breath on exertion. This is an expected cardiopulmonary adaptation because of the increased ventricular rate. Tapos elevated pa yung diaphragm niya. Yung A, B, and C, this is pathologic, may be a sign of impending cardiac decompensation. Number 46. Situation 6, part of the responsibilities of an OB ward nurse is to give proper health teachings to the mother and her significant other on how to take care of newborn. During a client's visit to the prenatal clinic, the nurse discusses a pregnancy diet. The client states that her mother told her she should restrict her salt intake. What is the nurse's best response? A. Your mother is correct. You should use less salt to prevent swelling. B. Because you need salt to maintain body-water balance. It is not restricted. Just eat a well-balanced diet. C. Salt is an essential nutrient that is naturally reduced by the body's estrogen. There is no reason to restrict salt in your diet. Or D. We no longer recommend that salt intake be as restricted as much in the past. However, you shouldn't add salt to your food. The answer here is very good. The answer here is letter B. Because you need salt to maintain body-water balance, it is not restricted. Sodium requirements increase slightly during pregnancy para ma-accommodate yung increased blood volume. A healthy pregnant woman should not limit her sodium intake. Yung letter A, this could be detrimental to the client's health, yung mag-restrict. Although sodium is essential, it is not a nutrient but a mineral. And then there are no restrictions on salt intake during pregnancy. Number 47. A pregnant client uses a computer continuously during her working hours. This has implications for her plan of care during pregnancy. What should the nurse recommend? A. Try to walk around every few hours during the workday. B. Ask for the time in the morning and afternoon to elevate your legs. C. Tell your boss that you cannot work beyond the 2nd trimester. Or D. Ask for the time in the morning and afternoon to get something to eat. The answer here is letter A. Try to walk around every few hours during the workday. Kasi walking, this contracts the leg muscles and applies gentle pressure to the veins, thus promoting venous return. Yung letter B, walking is better means of improving circulation is to walk and not just elevate. Tapos makaka-elevate naman siya sa legs niya while sitting at her desk. Letter C naman, there are no indications to working throughout her pregnancy if the client is feeling well. Tapos, letter D naman, adequate nourishment, ma-obtain niya yan during meal times. Hindi niya kailangan ng extra breaks, extra nutrition breaks. Number 48. A pregnant client is being prepared for a pelvic examination. She states that she is always tired and feels sick to her stomach, especially in the morning. What is the nurse's best response? A. Tell me about how you feel the rest of the day. B. Let's discuss ways to resolve these common problems. C. Perhaps you should ask your healthcare provider about it. Or D. There is no need to worry about these expected problems. The answer here is letter B. Let's discuss ways to resolve these common problems para makaka-participate siya sa kaniyang care. Yung letter A, hindi siya relevant at this time. Kailangan siya ng help sa kaniyang problem. So, no need for any psych verbalization. Letter C, this cuts off communication. tapos hindi nakaka-address sa concern. Same with letter D, cuts off communication siya. Number 49. What is the best advice a nurse can give to a pregnant woman in her first trimester? A. Cut down on drugs, alcohol, and cigarettes. B. Avoid drugs and refrain from smoking and ingesting alcohol. C. Avoid smoking, limit alcohol consumption, and do not take aspirin. Or D. Take only prescription drugs, especially in the second and third trimester. The answer here is letter B. Avoid drugs and refrain from smoking and ingesting alcohol. Yung sa letter A, guys, cutting down on these substances is insufficient. Kasi teratogens to and it should be eliminated. Letter C, even like 1 ounce ng alcoholic drink, guys, considered harmful na siya. Tapos, do not take aspirin. May ibang women, pregnant women, na binibigyan ng baby aspirin for the pregnancy-induced hypertension. Pero not during first trimester, ha? Yung letter D naman, medications unless needed should be avoided during pregnancy. Number 50, what information concerning the childbearing process should the nurse teach a client during the first trimester of pregnancy? A. Labor and birth. B. Signs and symptoms of complication. C. Role transition into parenthood and its acceptance. Or D. Physical and emotional changes resulting from pregnancy. And the answer here is letter D. Nasa first trimester pa lang siya, guys. So the best information to give is about increasing knowledge on the physical and psychological changes. Yung letter A, too early. Letter B naman, about, yes, it's important, pero more on physiologic changes dapat. Tapos yung role transition into parenthood and its acceptance, third trimester na to. Guys, is it okay if I'll give you a 5-minute break? Ang sakit talaga ng voice box ko. Just a short break lang po. I'll just drink water. Thank you. Hi guys, I'm back. So let's continue. Number 51. What change does a nurse expect in a client's hematologic system during the second trimester of pregnancy? A. Increase in hematocrit. B. Increase in blood volume. C. Decrease in sedimentation rate. Or D. Decrease in white blood cells. Second trimester. The answer here is letter B. Increase in blood volume. The blood volume increases by approximately 50% during pregnancy. Tapos yung peak blood volume occurs between 30 and 34 weeks gestation. Yung letter A, the hematocrit, it decreases as a result of hemodilution. And then yung sedimentation rate, it increases because of a decrease in plasma proteins. And then yung white blood cells naman, they remain stable during the antepartum period. Number 52. A client in the active phase of the first stage of labor begins to tremble, becomes very tense during contractions, and is quite irritable. She frequently states, "I cannot stand this a minute longer." What does this behavior indicate to the nurse caring for her? A. There was no preparation for labor. B. She should receive an analgesic for pain. C. She is entering the transition phase of labor. Or D. Hypertonic uterine contractions are developing. The answer is C. She's entering the transition phase of labor. Since yung contractions becoming stronger, last longer, tapos nagiging erratic, the client needs to apply much concentration and effort para yung breathing niya, ma-pace niya ng sakto. Yung letter A, guys, kahit well-prepared yung woman, they will experience these behaviors. Tapos, if they will receive analgesic for pain, it may reduce the effectiveness of labor. And then yung letter D, there was no indication that the contractions are hypertonic. Number 53. A nurse is caring for a primigravida during labor. What does the nurse observe that indicates birth is about to take place? A. Bloody discharge from the vagina increases. B. Perineum begins to bulge with each contraction. C. Clients become irritable and stops following instructions. Or D. Contractions occur more frequently, are stronger, and last longer. The answer is B. Perineum begins to bulge with each contraction. Nag-i-indicate to, guys, na yung fetal head nasa pelvic floor na siya and birth is imminent. Yung letter A and C, these are in the beginning of second stage. And then D, this describes the progress of labor. It is not a sign that birth is imminent. Number 54. For what complication should a nurse monitor a client when an oxytocin-pitocin infusion is used to induce labor? A. Intense pain. B. Uterine tetany. C. Hypoglycemia. Or D. Umbilical cord prolapse. The answer here is letter B. Uterine tetany. Kasi yung oxytocin, guys, di ba, it promotes powerful uterine contractions. So the uterine tetany may occur. And the need siya is stop. Yung uterine tetany, guys, these are contractions that last longer than 90 seconds. Yung letter A, intense pain, this can be associated with strong uterine contractions. It's not a complication. Letter C, this is unrelated. And letter D naman, this is not likely to occur when induction of labor is initiated. Number 55. During the postpartum period, it is expected for a woman to have an increased cardiac output with tachycardia. This knowledge should motivate a nurse who is caring for a client with cardiac problems to monitor for A. Irregular pulse, B. Respiratory distress, C. Hypovolemic shock, or D. An increase in vaginal bleeding. Answer is letter B. Respiratory distress. Okay, I'll repeat it after this one. Kasi, yung mobilization of extravascular fluid and the rapid decrease of uterine blood flow blood flow, the heart of a client with a cardiac problem may begin to fail. So as the heart fails, the respiratory rate and effort to increase in an attempt to maintain oxygen to all body cells. Pulse rate, this is important, pero the primary assessment should be for respiratory distress. Wait, I'll go back sa yung uterine tetany ha. Di ba nag-oxytocin siya, tapos nag-promote to ng powerful uterine contractions. It may cause uterine tetany. Yung uterine tetany, these are contractions that last very long. So need siya i-stop. Uterine tetany is a complication. It's not normal. No problem. Number 56. A nurse anticipates that newborns of mothers who have diabetes often have tremors, periods of apnea, cyanosis, and poor sucking ability. With what complications are these signs associated? Keyword dito, newborns of mothers who have diabetes. So A, hypoglycemia, B, hypercalcemia, C, CNS edema, or D, congenital depression of the islets of Langerhans. The answer here is letter A, hypoglycemia. Diba? Kasi yung pancreas of a fetus, of a diabetic mother, they respond sa hyperglycemia ni mother by secreting large amounts of insulin. So once they are outside na sa womb, this leads to hypoglycemia. Yung sa edema naman, edema may be generalized and not specific to the CNS. Hypercalcemia is not related. And then yung letter D naman, in response to increased glucose received from the mother, yung islets of Langerhans, they are hypertrophied. Mas grabing effort eh. They are not congenitally depressed. Number 57. What is the most important factor for a nurse to consider when selecting measures to help parent-child relationships during the immediate postpartum period? A, physical status of the infant. B, duration and difficulty of the labor. C, anesthesia during the labor process. Or D, health and emotional status during the pregnancy. This is letter A. Kasi guys, the attachment between parent and infant is most successful when interaction is possible immediately after birth. So if okay talaga physically yung infant. Kasi if the infant is ill, the contact is limited. Duration and difficulty of labor naman, it is also a factor. Pero mas important yung physical status of the infant. Same reasoning with C and D. Number 58, a mother is concerned that her newborn may be exposed to communicable diseases when she goes home. When teaching the mothers ways to decrease the risk of infection, what type of immunity should the nurse explain was transferred to her baby through the placenta? A, active natural, B, passive natural, C, active artificial, or D, passive artificial? Answer here is B, passive natural. This immunity is developed from an antigen-antibody response in the mother that is transmitted to the fetus. Yung A naman, acquired by an individual in response to disease or infection. Letter C naman, acquired by vaccination. And then letter D, injection of antibodies. Pwede pa ulit yung sa 25. Okay. Sa 55 pala. Kasi, di ba may client with cardiac problems. So, there is mobilization of extravascular fluid, and then there is rapid decrease in uterine blood flow. Because of this, the heart of the client with cardiac problem, it may begin to fail. Yung extravascular mobilization of extravascular fluid and rapid decrease in uterine blood flow kasi they are postpartum. So as the heart fails, the respiratory rate and effort increases in attempt to maintain oxygen to all body cells. That's why primary assessment is respiratory distress. Next is number 59. A client is rooming in with her newborn. A nurse observes the infant lying quietly in the bassinet with eyes open wide. What action should the nurse take in response to the infant's behavior? A. Brighten the lights in the room. B. Wrap and then turn the infant to the side. C. Encourage the mother to talk to her baby. Or D. Begin the physical and behavioral assessments. Infant is lying quietly. Answer is C. Encourage the mother to talk the baby. Kasi guys, if ang baby, they are in a quiet, alert state, this is the perfect time for infant stimulation, for communication sa baby. Yung brighten the lights in the room, this is disturbing to the newborns. Tapos makaka-affect siya sa mother-infant interaction. You just tell the mother that she just needs to talk to her baby. Yung letter B naman, this is used for a sleeping infant. And then letter D, not priority at this time. Number 60. What is a nurse's primary critical observation when performing an assessment for determining an APGAR score? A is heart rate, B respiratory rate, C presence of meconium, or D evaluation of Moro reflex. Answer is A, heart rate. Most critical observation in APGAR scoring. Yung RR kasi guys, it is very erratic. Tapos respiratory effort rather than rate yung dapat i-observe. Letter C, this may or may not be present at this time. Tapos hindi siya part ng APGAR scoring. Same ng D. Number 61, a parent and a 3-month-old infant are visiting the Well Baby Clinic for a routine exam. What should the nurse include in the accident prevention teaching plan? A. Remove small objects from the floor. B. Cover electric outlets with safety plugs. C. Remove toxic substances from low areas. Or D. Test the temperature of water before bathing. The answer is D. Test the temperature of water before bathing. Kasi excessively high temperatures can damage the skin of the infant. Yung letter A, they're probably not placed on the floor naman eh. Not yet able to crawl. Yung letter B naman and C, they don't have the motor capabilities to explore pa. So letter D talaga. Number 62. In a noisy room, a sleeping newborn initially startles and has rapid movements but soon goes back to sleep. What is the most appropriate nursing action in response to this behavior? A. Accept the infant's behavior. B. Assess the infant's vital signs. C. Test the infant's ability to hear. Or D. Stimulate the infant's respirations. The answer is A. Accept the infant's behavior. Kasi diba, na-startle and then goes back to sleep. Yung initial response na startling, that is the startle reflex. But once the stimulus is repetitive, the response to the stimulus decreases. So this is called habituation. Habituation. Yan yung decrease ng, this is the response to the stimulus decreases. Letter B and letter D, not necessary. And then, yung letter C naman, infant is responding to the noise, therefore nakakahear siya. Number 63, the nurse is caring for a 7-year-old female. My answer, never mind, my answer na. Nurse is caring for a 7-year-old female on the school age unit. Her mother is concerned that she may have some developmental delays. Which of the following statements would indicate to the nurse the child is not developmentally on track for her age? It's letter C. Because imaginary friends are common in preschoolers. Yung number 1, letter A pala, yung letter A, they should be able to follow 5 4 to 5 step command. So it doesn't indicate delay. Yung letter B, they are in a hospital. So inform the mother that bedwetting is a common form of regression seen in hospitalized children. And then letter D, these children naman, most school-age children, they do enjoy playing board games. Number 64. The nurse caring for an 8-year-old boy is trying to encourage developmental growth. What activity can the nurse provide for the child to encourage his sense of industry? A. Allow the child to choose what time to take his medication. B. Provide the child with homework his teacher sent in. C. Allow the child to assist with his bath. Or D. Allow the child to help with his dressing change. The answer here is letter B. Provide the child with the homework his teacher has sent in. Letter A, guys, medication should be kept on schedule. So it is essential na ibigay siya on prescribed time. Letter B, they are focused in academic performance. Itong age na to. Letter C, they should have mastered that taking a bath. It shouldn't be an accomplishment. And then letter D, the child may enjoy this with his dressing change, but not the best example for industry. Number 65, the school nurse is preparing discussion on nutrition with the 4th grade class. Based on the children's developmental level, what information should she include in her presentation? A review of the number of calories that a 4th grade child should consume in a day. B, a review of a list of high-calorie foods that all 4th graders should avoid. C, a review on how to read food labels so children know which foods are good for them. Or D, a review of nutritious food with basic scientific information about how they affect the body organ system. Correct answer is D. Review of nutritious food with basic scientific information about how they affect the body and organ system. Yung A and C, these are adult activities. Tong number of calorie counting, reading food labels. Tapos yung letter B, guys, they might take it as a challenge if pinakitaan nyo sila ng food that they should avoid. Hindi po ba stressful homework sa mga hospitalized child po? I think it is stressful. Next is number 66. A 9-year-old boy has been hospitalized. Pag hospitalized yung children po, dapat i-rest talaga yung number 1 priority sa kanila. 66. A 9-year-old boy has been hospitalized following a bicycle injury. What should the nurse recommend to the child's parents to prevent further injury? A, their son should wear safety equipment while riding bicycles. B, their son should read educational material on bicycle safety. C, should watch a video on bicycle safety. Or D, ride his bike in the presence of adults. Answer here is letter A. Son should wear safety equipment while riding bicycles. Yung letter B and C, these are good reinforcements but not enough. And then yung letter D naman, hindi always na may adult kasama. Okay. So if madidisgrasya siya, guys, yung letter B and C, wala siya maitutulong. Iba talaga yung may safety equipment. Sa 64. Okay. Yung the question, it focuses on sense of industry. Okay? So dapat alam nyo, guys, yung mga what are the things that makes them reach that developmental milestone. So they are focused in academic performance, so you should provide the child with homework his teacher has sent in. They are asking about industry, sense of industry. That's another board tip, guys. Even if kaya siya nakaka-confuse yung boards kasi situational talaga siya. You should hit you should take the answer, you should hit the question with an answer. Kahit in some questions hindi siya correct, basta dito, sense of industry. He is hospitalized, pero the school-age children, they are focused in academic performance. So this is the best answer, yung letter B. Next is number 67. The school nurse has seen several students in the health office. For which of the following students should the nurse suggest a follow-up exam? So which is worse? A, 14-year-old 14-year-old who has not experienced menarche. B, a 7-year-old boy who has grown 2 inches in a year. C, a 10-year-old girl who has gained 11 pounds in a year. Or D, an 8-year-old boy who has lost 4 deciduous teeth in the past year. Answer here is letter C, a 10-year-old girl who has gained 11 pounds in a year. Kasi guys, this requires a follow-up because of the rising rate of obesity in children. Average age of menarche is 11 to 15. Some say 12 to 16, but I think it's 11 to 15. Tapos yung school-age children, they grow approximately 2 inches a year and gain between 4.4 to 6.6 pounds a year. Tapos they lose these 4 deciduous teeth at the age of 6 to 8. Number 68. A child who has a BMI of 34 visits the school nurse. Which of the following factors does the nurse recognize the child may be experiencing? A, increased bullying by peers. B, increased self-esteem. C, increased resiliency. Or D, increased motivation to lose weight. For those, this is how you attack questions also. If hindi mo alam ano yung 34, like hindi mo alam na obese na siya, you check the choices. Ito lang yung negative. Ito yung different. So, increased bullying by peers is the answer. Kasi children, they may not be concerned about being overweight or obese and may therefore not be motivated to adopt healthier eating patterns. Tapos, they are often bullied basta obese. Number 69, which is the first intervention that should be recommended to a pregnant woman complaining of hemorrhoid pain? A, steroid-based screens. B, diet modification. C, surgery. Or D, oral medications. The answer here is letter B, diet modifications. First intervention muna tayo is high-fiber diet. Not recommended yung surgery kasi frequently resolve after pregnancy yung hemorrhoids. And then not recommended first-line treatment yung oral meds. Screenshot na siya. Next is number 70. A pregnant client presents with vaginal bleeding and increasing cramping. Her exam reveals that cervical os is open. Which term should the nurse expect to see in the client's chart notation to most accurately describe the client's condition? This is imminent abortion. The woman's bleeding and cramping increase and the cervix is open, which indicates the abortion is imminent or inevitable. Yung ectopic pregnancy, pregnancy is outside of the uterus. Yung complete abortion, contents of pregnancy have been passed. Incomplete, some contents have been left in the uterus. Number 71, a nurse is caring for a pregnant woman who states she smokes 2 packs per day of cigarettes. She states she has smoked in other pregnancies and has never had any problems. What is the nurse's best response? The best response here is letter A. I am glad to hear your other pregnancies went well. Smoking can cause a variety of problems in pregnancies, and it would be best if you could quit smoking with this pregnancy. Para siyang nag-flex, guys, no, na okay naman yung other pregnancies ko. You may, don't give any judgment about that kasi baka ma-offend. Pero you should give her factual information about it. Next is number 72. A nurse is caring for a client who has been in the second stage of labor for the last 12 hours. The nurse should monitor for which cardiovascular change that occurs during labor. A, increase in maternal heart rate. B, decrease in cardiac output. C, increase in peripheral vascular resistance. Or D, decrease in the uterine artery blood flow during contractions. This is letter A, increase in maternal heart rate. This is normally increased due to pain. resulting from fear, anxiety, and increased blood volume. Number 73, a nurse is assisting in the delivery of a term newborn. Immediately after delivery of the placenta, the nurse palpates the uterine fundus and finds that it is firm and located halfway between the client's umbilicus and symphysis pubis. Which action should the nurse take based on the assessment findings? This actually sounds good, sounds normal, so you just document the findings. Because fundus should be located 1/2 to 2/3 of the way between symphysis pubis and the umbilicus. Next is number 74. While assisting with the vaginal delivery of a full-term newborn, a nurse observes that in spite of the fact that the client did not have an episiotomy or a perineal laceration, her perineum and labia are edematous. To promote comfort and decrease the edema, which intervention is most appropriate? Answer here is letter A, applying an ice pack to the perineum. This reduces edema and vulvar irritation. You should teach the client to tighten to compress the buttocks, not relax. Next is number 75. Screenshot na to Number 75, a postpartum client who is 24 hours post-vaginal birth and breastfeeding asks a nurse when she can begin exercising to regain her pre-pregnancy body shape. Which response by the nurse is correct? Correct answer here is letter A. Letter A, simple abdominal and pelvic exercises can begin right now. After first postpartum day, they should be taught to start abdominal breathing and pelvic rocking. Next is number 76. A primiparous client who is bottle feeding her infant asks a nurse when she can expect to start her menstrual cycle, having her menstrual cycle again. Which response by the nurse is most accurate? The answer here is letter A. Most women who bottle feed their infants can expect their periods to return within 6 to 10 weeks after birth. Kasi in non-lactating women, yung average time to the first ovulation is 45 days. Tapos yung return of menstruation usually happens within 6 to 10 weeks post-birth. Ito na letter B, cessation of discharge is unrelated to return of menstruation. Next is number 77. While working in a perinatal clinic, a nurse receives a phone call from a client who is 20 days postpartum. The client tells the nurse she has been having heavy, bright red bleeding since leaving the hospital 18 days ago. She's concerned and wonders what she should do. Which instruction to the client is correct? 18 days ago na raw, guys. So letter A, come to the clinic immediately. This is suggestive of subinvolution of the uterus. Yung subinvolution of the uterus is the most common cause of delayed postpartum hemorrhage. Number 78. Screenshot na to Number 78. The husband of a postpartum client who has been diagnosed with postpartum depression is concerned and asks a nurse what kind of treatment his wife will require. The nurse's response should be based on the knowledge that the collaborative plan of care for PPD includes which of the following? Answer here is letter A. Antidepressant medications and psychotherapy. Hindi enough yung supportive treatment alone. And then, not necessarily yung removal of the infant, pero she should not be left alone with the infant if may nakikitang aggression na towards the infant. Tapos hypnotic agents should not be used during postpartum period. Number 79, the father of a 12-hour-old newborn calls the nurse into his wife's hospital room. He's agitated and reports to the nurse that his baby's hands and feet are blue. The nurse confirms acrocyanosis and intervenes by letter B, explaining to the father that this is an expected finding in newborn. Number 80, while assessing a full-term newborn, a nurse notes molding on the infant's head. Considering this assessment finding, which information should the nurse expect to see on the mother's labor and delivery documentation? A, vaginal birth, planned cesarean section, no labor. C, 16-hour labor. Or D, precipitus, delivery after 30-minute labor. The answer here is letter C, 16-hour labor. Kasi yung molding, this is a change in the shape of the fetal skull by the force of the uterine contractions. Longer labor will increase molding. Yung vaginal breech birth, it's the buttocks that is the presenting part and not the head. Number 81. The nurse evaluates that a mother understands information provided about her newborn's media when the mother says, A, I will put lotion on my infant's nose twice a day. B, I understand these race-wise spots will clear up without treatment. C, I realize the baby will need surgery to remove these skin lesions. Or D, I will apply alcohol twice a day to the lesions until they disappear. The answer is B. I understand these race-white spots will clear up without treatment. Number 82. While caring for a 30-year-old single female who delivered the term newborn, a nurse determines that the best way to assess the impact of the newborn on the client's lifestyle would be to A, observe how the client interacts with their hospital visitors. B, review the client's prenatal record. C, ask the client what plans she has made for newborn care at home. Or D, observe the relationship between the client and her newborn's father. Single female, guys. So the answer is letter C. Ask the client what plans she has made for newborn care. Kasi yung issues talaga dito, basta single parent, is low income. And then walang reliable backup person. Next is number 83. While caring for a small gestational age newborn, the nurse notes slight tremors of the extremities, a high-pitched cry, and an exaggerated Moro reflex. In response to these assessment findings, what should be the nurse's first action? Ang answer dito is letter A. Assess the infant's blood sugar levels. Yung small for gestational infants kasi, they are at risk for hypoglycemia because of this. They have poor hepatic glycogen stores and inadequate supplies of enzymes to activate gluconeogenesis. Kaya may slight tremors, high-pitched cry, yun siya. These are signs of hypoglycemia. Itong tatlo, tremors, high-pitched cry, exaggerated Moro reflex. Number 84, a nurse is planning the care of 2-year-old infant at 38 weeks gestation whose mother has a type 1 diabetes mellitus. The nurse writes the following NANDA diagnosis, altered nutrition less than body requirements, and appropriately adds which related to statement. The answer here is letter C. Letter C. Increased glucose metabolism secondary to hyperinsulinemia. Kasi the glucose supply from the mother is disrupted and the neonate's blood sugar falls rapidly in response to the corresponding high levels of circulating insulin. Number 85. When assessing an infant undergoing phototherapy for hyperbilirubinemia, a nurse notes a maculopapular rash over the infant's buttocks and back. In response to this assessment finding, what action should the nurse take next? A, document the results in the newborn's medical record. B, call the healthcare provider immediately to report this finding. C, discontinue the phototherapy immediately. Or D, assess the infant temperature. The answer here is letter A. Document the results in newborn's medical record. Kasi as a side effect of phototherapy, some newborns, they develop a transient maculopapular rash that does not require treatment. Only action required is document the findings. Next is number 86. Situation 8. As a nurse, it is very important to be knowledgeable not only on what are the normal signs, but also on the abnormal signs. A meticulous eye and quick decision-making skills make the difference, especially in handling difficult cases. If a nurse is concerned that a newborn may have congenital hydrocephalus, which assessment finding is noted? This is letter A. A bulging interior fontanelle is an initial sign of congenital hydrocephalus. Itong low set ears, this is sign of trisomy 21. Number 87. While caring for a client with severe preeclampsia who's been receiving intravenous magnesium sulfate for 24 hours, a nurse evaluates that the medication is effective when noting letter B. An increase in urine output. Yes, increase. Kasi diuresis within 24 to 48 hours is an excellent prognostic sign. This means that there is perfusion of the kidneys has improved as a result of relaxation of arteriolar spasms. Negative sign yung increase in blood pressure, dapat decrease. Decrease in platelet count levels indicate more blood vessel damage. And then yung increase in hematocrit, it also indicates more blood vessel damage and it's not a positive sign. Number 88. After teaching a group of parents of preschoolers attending a well-child clinic about oral hygiene and toothbrushing, the nurse determines that the teaching has been successful when the parents state that children can begin to brush their teeth without help at which of the following ages? 3, 5, 7, or 9? The answer here is letter C, 7. Kasi yung children that are younger than 7 years old, wala pa silang manual dexterity. Manual dexterity means using the hands in a skillful or coordinated way. So, hindi pa coordinated yung hands nila for toothbrushing. So, need pa nila ng help from parents. Number 89, after having a blood sample drawn, a 5-year-old child insists that the site be covered with bandage. When the parent tries to remove the bandage before leaving the office, the child screams that all the blood will come out. The nurse encourages the parent to leave the bandage in place and tells the parent that the child is letter B. Does not understand body integrity. Kasi they view medical and surgical treatments as hostile invasions that can destroy or damage the body. Meron silang fear of mutilation. So, yeah. Next is number 80. Next is number 90. The mother of a 4-year-old expresses concern that her child may be hyperactive. She describes that the child as always in motion, constantly dropping and spilling things. Which of the following actions would be appropriate at this time? Correct answer is letter B. Letter B. Preschool-age children, grabe talaga yung energy nila, guys. So, there may be times that they are not able to judge distance or estimate the amount of strength needed or balance for activities. So, not associated naman yung any changes at home. Tapos, being abused, dapat withdrawn sila, hindi energetic. Not needed yung pediatric neurologist. Number 91, a nurse is assessing the growth and development of a 10-year-old. What is the expected behavior of this child? A, enjoys physical demonstrations of affection. B, is selfish and insensitive to the welfare of others. C, is uncooperative in play and school. Or D, has a strong sense of justice and fair play. The answer is D. Has a strong sense of justice and fair play. Yung affection, guys, embarrassed na sila nun. Tapos, they are concerned about others and cooperative in play and school. So, mali itong B and C. Number 92, the mother asked the nurse about her 9-year-old child's apparent need for between meal snacks, especially after school. When developing a sound nutritional plan for the child with the mother, the nurse should advise the mother, A, that the child does not need to eat between meal snacks. B, should eat the snacks the mother thinks are appropriate. C, should help with preparing his or her own snacks. Or D, will instinctively select nutritional snacks. Answer is letter C. The child should help with preparing his or her own snacks. Para maka-learn din sila sa basics of nutrition. Andito na sila sa development wherein they can categorize or classify. Next, number 93. Which of the following actions initiated by the parents of an 8-month-old indicates they need further teaching about preventing childhood accidents? The correct answer here is letter B. Placing a car seat in a front seat, front-facing position. Dapat nasa middle of the back seat Yan yung safest area of the car. Number 90, wait, rush muna. Yung sa number 8, placing a fire screen in front of the fireplace. Burns are major cause of childhood accidents. So, using fire screens in front of fireplace can help prevent children from getting too close. Tapos, inspecting toys for loose parts para hindi ma-aspirate or ma-swallow. Then, letter D, poisonings kasi, they're commonly caused by improper storage. So, dapat out of reach. Number 94, a nurse is assessing the growth and development of a 14-year-old boy. He reports that his 13-year-old sister is 2 inches taller than he is. The nurse should advise the boy that the growth spurt in adolescent boys compared with growth spurt of adolescent girls is letter C. Tama kayo. Letter C. Occurs 2 years later. Adolescent boys lag about 2 years behind adolescent girls in growth. Kaya if napansin nyo, nung grade school, ang taas ng girls. Pero nung junior high or senior high, ang taas ng boys. Most girls are 1 to 2 inches taller than boys at the beginning of adolescence, but tend to stop growing approximately 2 to 3 years after menarche. 95. Parents of a 15-year-old state that he is moody and rude. The nurse should advise his parents to. This is letter B. Discuss their feelings with their child. Kasi yung healthiest manner is communication. Pag i-restrict nyo guys, mas magiging rude or moody yung 15-year-old. No need for obtaining family counseling. Tapos talk to the other parents of adolescent. Baka different yung adolescent nila. Like each teenager is different. Number 96, a mother tells a nurse that one of her children has chickenpox and asks what she should do to care for the child. When teaching the mother, the nurse should instruct the mother to help her child prevent. Answer here is letter C. Skin infection. The lesions can cause severe itching. So, kaya siya skin infection. Acid-base imbalance, it doesn't happen man sa chickenpox. Tapos yung malnutrition, a chronic problem to with the ingestion of inadequate diet over a long period of time. Also not related. Respiratory infection, not related also. 97. The school nurse develops a plan with an adolescent to provide relief of dysmenorrhea to aid in her development of which of the following? The correct answer here is letter B. Letter B. Kasi, relieving dysmenorrhea in adolescent is crucial for the female's development of positive self-identity. Dapat hindi na-view yung menstruation as painful and debilitating. Pero usually, ganyan yung nangyayari, especially if like sobrang sakit na. Number 98. The mother asked the nurse for advice about discipline for 18-month-old. Which of the following should the nurse suggest that the mother use? A. Structured interactions. B. Spanking. C. Reasoning. D. Timeout. Correct answer here is timeout. Most appropriate discipline for toddlers. Kasi, you remove them from the situation, tapos makaka-regain sila ng control. Yung structured interactions is good for preschool. Yung spanking, it has serious negative effects. Yung reasoning naman, this is appropriate for older children. Number 99. To assess the development of 1-month-old, the nurse asks the parent if the infant is able to A. Smile and laugh out loud. B. Roll from back to side. C. Anong break time, girl? Diyos ko. B. Roll from back to side. C. Hold a rattle briefly. D. Turn the head from side to side. Ano answer niyo dito, guys? Letter D. Letter D. Pero, actually, guys, I think tulog ako or half asleep ko ako nung ginawa ko to. This is head lag. Head lag dapat yung 1-month-old. I'll show you ha. This is based from my notes from Sir October. Screenshot this one. Cephalocodal development. 0 to 1 month is still head lag. Next is number, na-screenshot na ha. Number 100. While assessing a neonate weighing 7 pounds, who was born at 39 weeks gestation to a primiparous client who admits to cocaine use during pregnancy, which of the following would alert the nurse possible cocaine withdrawal? A. Bradycardia. B. High-pitched cry. C. Sluggishness. Or D. Hypocalcemia. Answer is letter B. High-pitched cry. Manifestations ng cocaine withdrawal, shrill, high-pitched cry, yun siya. Tapos, they usually appear within 72 hours. Tapos, several days yan maglalast. Yung bradycardia associated with preterm neonates. Tapos, yung sluggishness for mothers who receive analgesia. So, okay, so we're done, everyone. And show ko na. Wait, stop share ko muna. I think I can finally turn on my cam. Para hindi, kasi I was scared na baka mag-lag. O, di ba? Super haggard. So, thank you very much, everyone, for since last night for listening. And I hope that you guys, I really believe that you guys will pass the board exams. And of course, being a top-notcher is not impossible. Coming from me, the highest ko is like around 78 lang yung recalls. So, yan siya. Okay? Good night, guys. Thank you very much.